Hel- Hello, everyone, and welcome back to day 2 of our 2025 Workforce Summit, hosted by ACU Star 2 Center, the NTAP on Clinical Workforce Development at Community Health Center, Inc., and the National Association of Community Health Centers. My name is Megan Andrews, and I'm the Senior Program Manager with the NTAP on Clinical Workforce Development at Community Health Center, Inc. And I'm so excited that you are all joining us either again from day 1 or joining us for the first time. With that, we're going to go ahead and kick off day 2. So just a few reminders on our housekeeping. This is set up as a webinar, so your microphone and camera are disabled for this webinar. As a reminder, we welcome you to join flexibly, so feel free to join and leave as your schedule permits, and we welcome you to rejoin us at any time when your schedule allows. We know this is a large chunk of time to block off, so we appreciate you blocking off any amount of time that you can to join us. We also welcome you and encourage your participation, so feel free to ask questions to our speakers via the Q&A function at the bottom of your Zoom screen. Chat is also enabled, but we welcome you to add comments to our speakers in the chat so we don't lose any of your important questions. So again, all your questions put in the Q&A so our speakers don't lose track of them. For breakout groups, please note that you will need to switch Zoom links to join those breakout groups, and we'll have those instructions as the breakout groups approach today. And then finally, a reminder for our feedback. We love to hear your feedback. So after each session, we will launch an evaluation and we will launch one at the end of the day. So feel free to complete any and all of those. And then for follow-up materials, the slides and a recording of the Workforce Summit will be emailed to all registrants 1 week after the event concludes. If you have any questions while with us today, feel free to put those in the chat, in the Q&A, and we will get back to you as well.
Wonderful. Thank you so much, Megan. Hi, everyone. It's so lovely to be here with you all again, or for the first time today. My name is Sydney Axelrod. I am the Associate Director of Workforce Development at ACU, or Association of Clinicians for the Underserved, Star Center. Really thrilled to have you all here today for day 2 of our 2025 Workforce Summit. The theme of this year's summit is building a workforce for 2025 and beyond. And really, we want to take this opportunity to bring together all of you lovely folks from health centers, from HCCNs, from PCAs, from other valuable partners in this space, to really give you a chance to connect and hear some best practices, and not just the things that are working well, but the things that you're finding challenging as well. So we have another great full day of programming for you here today. We're going to do, same as yesterday, a combination of some presentations, some panel discussion, some large group conversations, as well as some breakout groups which Megan had mentioned, which are a really wonderful opportunity for you all to get to connect with one another and share some ideas, successes, challenges, what you all are working on. So really encourage you all to take advantage of all of those opportunities. And as Megan said, as you are able, you are welcome at any point throughout the day. So moving on to our agenda for the day today, lots of really great topics to bring you all today. Our first session this afternoon or morning, depending on where you are, it's going to be focused around leadership and mid-level management training. So really looking forward to that conversation. Again, an opportunity for breakout groups to really have a meaningful discussion about what we're hearing in that initial conversation. We'll take a break in the middle of the day, and then I will come back at 2 o'clock to lead a session around navigating and enhancing effective intergenerational communication. So I hope to see you all for that one as well. We'll take another little break, and then our 2 final sessions this afternoon will be on building training programs in your health centers, and then our final session around strengthening emergency preparedness for the community within your health centers. So lots of really great content on a kind of a wide span of workforce issues. And just as a reminder, throughout the day, we would love to hear from you. So all of your ideas, your questions, your thoughts, your comments, please use that Q&A function and that chat function. We really want this to be a meaningful time for all of you.
Awesome. Fantastic, Sydney. And speaking of hearing from you, we are going to go ahead and launch a few word clouds to kick off our morning and kick off our discussion. So as a reminder, yesterday we had one word cloud on what motivated you to attend the 2025 Workforce Summit. So sharing the results from that, we heard a lot of you saying you wanted to be networking, learning, innovation, gather knowledge, all the goals of the Workforce Summit. So we're so glad you were able to find out about this activity and join us. And with that, we're going to have two more word clouds to kick off our morning. The first is, what is one word that captures your biggest takeaway from day one? You can engage with this word cloud by using the link put in the chat. You can go to menti.com and enter the code shown on your screen, or you can use your cell phone and you can scan the QR code that is shown in the bottom left-hand corner. If you have any technical difficulties, feel free to put those in chat so we can see them. And I see we're starting to get response with uplifting, networking, learning. Awesome. So really echoing that sentiment that we heard in yesterday's word cloud. Great. I'm seeing responses of AI, which we had a wonderful panel presentation on yesterday. So again, if you weren't able to attend with us, we'll have that recording for you. I see a note about apprenticeships. Again, a fantastic presentation on dental training program apprenticeships. So we can provide those resources for you as well. I see creativity, learning, uplifting, engagement, all wonderful responses. Awesome. And I encourage any of you that are still working on this to continue to submit your results, and we'll share them during our breaks and at the end of day today as well. But I'm going to go ahead and move to our next one, which is, what is one thing you hope to gain from today's session? So Sydney just shared the agenda today. We'll have presentations on leadership and mid-level management training. We'll have conversations on intergenerational communication. We'll have a panel presentation on building training programs, and we'll also talk about emergency preparedness. So what are you hoping to see from those sessions today? So I'm seeing improvement, empowerment, understanding, insight, grow from within. That's amazing. I think we heard that yesterday in the dental training programs, as well as starting at the beginning and then continuing to grow from there. So I love that. Great insight, improvement, understanding. Great. Well, we hope that all of these goals are accomplished today in our 4 wonderful sessions. And again, we'll check back in with you during those breaks on these word clouds and a few others as well. I'm going to go ahead and transfer back to our final remarks for today. And again, you can continue to complete those. They do remain open, so more than welcome to hop back into that Menti and complete them. And Sydney, do you want to go ahead and give our thank yous?
Yes, thank you first and foremost, Megan. And thank you to all of you who participated in those word clouds. It's such a joy to see all of these positive words associated with your experience yesterday and all of these really inspiring goals for today. So thank you all for contributing, and please keep those coming. We love to see it. Just a very brief kind of final round of thank yous to everybody who put in a lot of hours and hard work to make this 2-day virtual summit possible. First and foremost, to our summit advisory group. This is an entirely volunteer group of folks from health centers and other partner organizations across the country. And we're so grateful for your time, your thought partnership, your energy, your connections, your presentations. Truly, the programming would really not be possible without that valuable input. Also want to thank our summit planning team, which consists of staff from CHC Inc., from ACU's STAR Center, and from the National Association of Community Health Centers, or NAC. Really a pleasure to work with you all, and thank you to everybody. It really takes a lot of hands involved to put on a program like this, and so grateful for all of our collaborators and partners. And lastly, and probably mostly, thank you so much to our federal partners from the Health Resources Services Administration, without whom we would not be able to put on programming like this that is available to all of you across the country free of charge. So always grateful to have the opportunity to provide programming like this for you all. So thank you to our federal funding partners at HRSA. And with that, I think we're ready to get going for the day. Megan, I will pass it back over to you.
Awesome. And I'm going to pass it off to my friend Gerard.
Thank you very much, Megan and Sydney. And hello, everyone. It's great to be back with you for day 2 of our Health Center Workforce Summit. I have the privilege of introducing our next session and speakers on leadership and mid-level management training. As you all may recall, in the National Training and Technical Assistance Needs Assessment that has been handled or carried out by the 20 plus National Training and Technical Assistance partners. Uh, Both leadership and mid-level management training has been one of the top identified training needs that the Health Center workforce, identified. And so this session will address some of those needs that you've identified in terms of training. We can move to the next slide. We're excited to have our presenters for this session with us today. They are decades of experience in the community health center movement and in this work of leadership development and training. They're going to be speaking to us on the topic today of leading with purpose, building people, quality, finance, and governance from within. So with us today, we'll have Pamela Tripp. Pamela is the president and founder of Corporate Transcendence, and their Leadership Excellence Operations System, which is a framework that's designed to drive operational excellence across FQHCs and other healthcare organizations. She's a proven turnaround CEO for health centers, and she's consistently led organizations from instability to strength with clarity, strategy, and heart. She's joined by Dr. Regina Gainey, who has her doctorate from Charlotte Christian College and Theological Seminary and brings 18 years of hands-on experience in the community health setting. As the Senior Director of Education with Corporate Transcendence, she leads national initiatives that are focused on developing value-driven leaders, advancing workforce transformation, and cultivating organizations from the inside out. And then lastly, Christopher Van is the Senior Executive for Development with Corporate Transcendence. He holds his Master's in Health Administration from the Gilling School of Global Public Health and is currently pursuing a Master of Divinity at the Southern Baptist Theological Seminary. His journey with health centers began at just 13 years old as a volunteer in southeastern North Carolina. Believe it or not, Chris, that's where I was born. And after completing his graduate studies, he returned to that same health center in 1996 to launch a career that now spans over 29 years, including 15 years in senior leadership roles. We're so happy to hear from them and learn about the LEOS system. So without further ado, let's give our attention to the Corporate Transcendence team.
Thank you, Gerard. We appreciate that so very much, and we are so excited about being with everybody today. Our community health centers we want them to be excellent in each and every way possible, and that begins with leadership, right? Leadership excellence. So in order for us to have leadership excellence, then we have got to lead with purpose. Very intentional about how we lead. So, and that, as Gerard said, is our topic today, and that we'll go into those objectives, but we're going to introduce to you, I hope, what you're going to find to be a very more simplified and a very complex company to lead, and that's a healthcare company or a healthcare community health center. There is nothing simple about healthcare. It is very convoluted and very complex, whether in ambulatory settings or in tertiary settings, wherever you're at, it's the same. It's convoluted and complex. It requires a lot of attention in a lot of different directions. And so the challenge of that is, how do we do that? So I'm going to introduce you to LEOS, and I hope that's going to really help you see some ways to work through that. You can back up to the objectives, Chris. So I want to just say that LEOS was birthed out of the community health center system. Okay, so this is unique to the health center, but it can be applied to any healthcare organization or to other organizations. And why the four components of LEOS are so important. And then through this framework, this model of leadership, we're able to lift up the important areas of significance to have organizational success. Okay, so let's jump right into it. LEOS. So what is that? It says it means leadership, excellence, operational system. Leadership, excellence, operational system. It is made up of 4 pillars. You can call them pillars. We call them trees of transcendence. Why do we call them that? It's because a tree bears fruit, and we hope to always be above and beyond where we are today. We always want our excellence tomorrow to be always greater than today. So, how do we get our hands around leadership? There are so many different departments, so many different divisions that are all very important. So let's talk about the way we can use this model to simplify our leadership, whether you're a beginning in leadership, or you're continuing at mid-level leadership, or you're at senior leadership, wherever you're at on your leadership journey, this will apply for you. So the first pillar is the most important one, and that is people. That's the heart and soul of your organization. Really and truly, when we take our people and remove them from our buildings, we just have brick and mortar, right? Or sheetrock, whatever the case can be. But people is truly what make up the company environment. They will either make or break the company. Okay. And our role as leadership is to make sure we support the people in order for them to grow and develop themselves, so our organizations will grow and develop. That is directly proportional. As we build and grow our employees, our colleagues, our co-workers, whatever name we call them, we are continually to build and grow our organization. The other area of LEOS is quality. Okay. And so when we think about quality, we think about systems. All right. Systems, work processes, workflows, quality. We think about quality of our patients, right? The quality of care they're receiving, and how important that is. It's very important that we get the best clinical outcomes on them. And I'm going to talk more about quality, how it flows into the other areas too, in just a moment. Finance. Okay, we think about finance, that's our resources. Okay, they say, well, that is whether we get paid or not. But really and truly, it's so much more than that. Our finances are so important, and because we want to be able to reinvest into our community health centers to make them stronger, to enhance our services, to give better benefits to our colleagues, and to be the very best that we possibly can be. Governance is accountability. So they're the must do, should do, will do regulatory pillar or tree that is in the LEOS. So it's people, quality, finance, and governance. And that is the secret sauce to leadership. Everything that takes place within your company, within your community health center, can be put under each one of these pillars. Okay, so let's look a little deeper. Why is LEOS important? Because we must be very intentional about how we lead. Leading people cannot be a random exercise by far. We know that. We must lead with great intentionality, because if we don't, then we're really not leading. And we have to do that in order for people to follow us, right? And to partner with us. I really don't like the word following as much as I like the word partnering with us. When we are leading with intentionality, then everybody is partnering together to move in that intentional direction, which is so important. It must be sustainable. Will the LEOS leadership model pass the test of time? And it will. It is very sustainable, and it's very good for the organization in that as you use this model within your organization, it becomes something that will succeed as leaders retire and move forward and new leaders are coming up. Everybody is working off the LEOS system. And through that, it's going to create that operational alignment that we need so desperately in our community health centers. It's going to be very empowering for our wonderful workforce that we have. And then we want something, as I said, sustainable that can anchor down and we can see results in those 4 areas of people, quality, finance, and governance. So we're going to dive just a little bit deeper. People, and I've got 30% under there. Okay, the people excellence operational system. You could call this your company excellence operational system because, like I said, your company is your people. Either way you want to call it. And we say PIOS, or you can say CIOS. But why is that so important? And when I say people, I mention our colleagues, our employees, our coworkers, but this includes the patients, it includes the board of directors, your volunteers. It even includes the people that are coming in and out in clinical training programs. It's all people, vendors, guests, all people. So we want all people to be very satisfied, fulfilled, engaged, and want to work or be at your organization in our community health centers. So, you know, we talk about being the provider of choice, being the employer of choice, and they're nice words, but what does it take to get behind those words to make it happen? So let's talk a little bit about that. So if you look at the people tree, we want to make sure that we're focusing on the right areas to get the results we want. So one would be, let's say, our patient satisfaction. It's very important, the patient experience. So that would be something that we would want to monitor and we want to look at and always be working on to prove how we are caring, or what is the perception of how we're caring for our patients. We want them to love us, right? So a lot of attention needs to be put there. They're people. Let's talk about the important heroes in healthcare that were heroes way before COVID, and that is the caregivers and all the people behind the support, care coordination, community outreach workers, finance department, human resources. Everybody has a part of that caregiving, and everybody is a hero, in my opinion, in healthcare, because what I have learned over a lot of years is no one gives as much as caregivers. In fact, they give until they've got nothing left. And that is what we're seeing when we read about the sad stories about the state of healthcare workers in America today. They're not very fulfilled in the systems that we have. But putting people first and noticing and looking at their engagement surveys, their colleague engagement surveys, their employee engagement surveys, workforce engagement surveys, whatever you call them, is good feedback for the organization to understand how we can help and support our colleagues, our heroes, more. And so 30% is at the top here. I haven't explained that. We have 4 trees, and the 30% means that 30% of the leadership time and all the other middle management and anybody and everybody in the organization, we need to be focusing on people. Like I said, that is our employees, our guests, our patients, our clients. It is people. 30% of our day, 30% of what we do and our time, energy, and efforts needs to be focused on people. So we need to measure how we focus on them. And here are some examples of how that can be done through patient engagement surveys. You know, do people come to us? Are we getting new patients? You know, we call that unique patients, right? We like big numbers of unique patients, more patients coming to us. Colleague and provider engagement surveys. And colleague is a word we use at Commonwealth Health a lot, and it means employee, by the way. So and leadership development, and internal promotions. And so within the people, what are we doing to grow our future leaders, to grow individuals to be the best they can be? So these are things that we want to focus on, very, very high priority for our organization. This probably, and by far, is, and they're all 4 trees, very important, but this one must come first. So I'll go ahead and say this: people are your first priority. You got 4 trees, but which one comes first? It's people. Okay. Quality. So we really want to know that we're delivering fantastic quality, that our services are getting the outcomes that we want them to get. And so we need to focus on our quality, the quality of the care, the quality of our billing. You know, is our billing, is it performing well? So quality integrates in every area of the organization. We typically think about quality just with the patient and their outcomes, but really and truly, it could be in any area of your organization. Is your safety program of great quality? Is you know, your problem solving model that you're using, is it giving you what you need in the quality tree? So 30% of our time is spent on quality. It's so important that all our areas are producing and giving us the results that we need. And I keep talking about results and key outcomes. And so all of this, we have now electronic records that we're able, and we have financial software and all these things that we're able to pull information from, and we're able to take that information and learn from it, and do the analytics of it, and really come out with better processes on how to perform our jobs. So quality, you could look at all kinds of quality improvements throughout your organization. You know how important it is that we have a very patient-centered, integrated, very multidisciplinary care model within our community health centers. And so that is looking at the quality of that. Is that performing the way it needs? Are we getting the referrals? And is it integrated within the departments of the community health center? And then, of course, I mentioned patient clinical outcomes, your continuous improvement model, making sure it is something that is really user-friendly and palatable to everyone within the organization, because guess what? We want everybody to be working on improving their processes. And then when you do have best practices, then you discover them, that you share them among your different locations, and you really begin to pick up momentum when you do that. And we have to look at quality and systems as something that we want to always be very robust about, and be aggressive in how we can improve them and make them better. Because like I said, our excellence tomorrow is always going to be greater than our excellence today. So anyway, we'll go to the next one, which is finance. And yes, that's the money tree. And man, we like a money tree, don't we? Sometimes in our backyards. But this is so important too. And we all have to be good stewards of our money. And we need to be transparent in many ways with our employees about how we're funded. Why are we doing this when I understand you just got a grant, but maybe people don't understand that grant is designated for a certain function, and it must be used for that individual function, and it can't support this over here. So it's very important to be very transparent when it comes to finances of the organization, because that's the only way really our people are able to support what we are trying to do within the organization. So anyway, making sure that we have strong financial dashboards, that we are looking at industry standards and benchmarking ourselves against those, other community health centers, banking industry standards, and is that open and available for everybody to see? If we're falling down and we're not, for instance, and I'll give a quick example, January and February in North Carolina, we had snow days, and it was snowing from the mountains to the coast. So there's several days in those 2 months we lost revenue because we couldn't open. But being very upfront and honest is we lost this many patients. We did not see this many patients. We didn't lose them. We did not see this many patients, and this was the monetary value it affected the organization. So how do we work together to come back? And through just the collaborative leadership of everybody working together across all the departments, we were able to come back with a bumper April, which I just heard. So I'm very excited about that. So finances are important. It makes a difference. But if you don't understand that as a employee, the impact of finances, if the organization's not transparent with that, you can't understand why you might have to have an extra patient or two on your schedule. So anyway, very, very important. Finances give us resources. And then governance. And notice it was 30% on finance too. So 30% of our time we spend on finance, anything related. Governance is 10%. Now, this is a flip of the paradigm. If you've been in healthcare a number of years, you probably have spent more time talking about when the next operational site visit's coming, or this rule or regulation, or this governance mandate, or what does HRSA want us to do. You're talking about those regulatory things all the time. Or you're talking about a complaint from patient experience, or maybe it's staffing issues. Okay. So, but when you come to governance, we only spend 10% of that time. And the reason for that is because if you get, as leaders, if you put the right amount of time and energy and effort into people, that 30% into quality, 30% into finance, guess what? You do not have to spend as much time on the regulatory. The regulatory takes care of itself to a great degree. So what do we always hear? We need to be always ready and prepared for our operational site visit. We need to always be ready and prepared for Joint Commission or our Ryan White surveys. But in order to do that, you can't prepare a month or two ahead of time. You've got to have it worked within your leadership system, that it's always being worked on. And so should they come, you're ready. Not that you're not going to do checklist a little bit before they come, but the load of that is going to be always being worked on across the organization. So it is LEOS, Leadership Excellence, Operational System. The first tree is people. It's your company. It is what makes your company what it is. The second is quality. That is systems. Everything has a touch point, multiple touch points throughout the organization, and many systems overlap each other. The next one is finance, and that is so we have great resources, that we work and we're very knowledgeable about the finances of the organization and how FQHCs operate. And the last, of course, is governance, which is very important, very, very important, but we spend 10% there. So we have flipped the paradigm pretty much. So just re-emphasize, because I can't say it enough, people come first. So the tree of transcendence we have to keep in our mind is that people is the first priority, because we cannot give what we do not have. And we need to invest into our people so they will deliver what we need to achieve as an organization. We love the O2 principle. The O2 principle says, put the oxygen mask on the employee so then they are able to put it on the patient. And the other thing that we talk about a lot in valuing people and the people priority in that tree is that we believe The value means everybody comes to the table with gifts and talents and strengths, abilities, perspectives, all kinds of great things that we can learn from and grow from. And so the value means we want to learn from you. And then I hope you can learn something from me. But we value each other regardless of our role and responsibility. Everybody is equally valued within the organization because they have their own uniqueness and their DNA to bring to the table. So with that, I think I'm going to turn it over to my wonderful colleague, Christopher Van.
Hi, good afternoon, everyone. Thank you so much, Pam. Pam introduced today a streamlined framework for understanding our operations and our health centers and really any organization. And it's one that we believe that really helps leaders to simplify their responsibilities while strengthening their communication and their connection with their colleagues. And you'll know that Pam emphasized that within that LEOS model, the very first and the most critical area to address is, in fact, people, our people. And in other words, we have to care for people, for the people who are caring for other people. And I think this idea really echoes well in the words of James Baldwin, who in his book, No Name in the Street, said that not everything that is faced can be changed, but nothing can be changed until it's faced. And what we must face now are the alarming trends emerging in today's healthcare workforce. And so in the spirit of and the context of focusing on people, I want to take just a few moments to kind of share where we are in the state of the country's workforce, but specifically more in healthcare. I asked AI to sum up in an image to generate an image that what AI felt like represented the state of the nation's healthcare workforce today. And this is what AI generated. And I think this is very, very telling and very true about what is happening, again, not just in the healthcare workforce, but the entire workforce across the country, and how that informs the decisions that we make as leaders at the senior level, at middle management, anywhere inside our organization. And so what we're seeing right now that is the U.S. workforce is facing strain. There's approximately 7 million open jobs, plus minus. Right about the same amount of people are unemployed. But what we're seeing very soon here is that the youngest baby boomers are going to hit retirement age at 2030, which is raising the real possibility for all of us of a retirement cliff. And this is representing 72 million people in the United States that are going to be at retirement age. We're also seeing that turnover is still very high. This was, I believe, about a year ago, 40%, 47% of employees were leaving their jobs every year. But most of them, what's really telling here is that most of them are choosing to leave on their own. At that time, it was about 73%. And in healthcare, the situation is especially urgent. The CDC and their workforce study, a recent workforce study conducted in the last couple of years, reported that 46% of healthcare workers felt burned out, and this was in 22. And that was up from 32% a few years earlier. And 44% said that they were considering a new job. And we know that these issues didn't start with the pandemic, but the pandemic certainly did push them forward. But nevertheless, the data is very clear. We're at a critical point with our people, and healthcare is really at the heart of that challenge. So we're seeing three major forces that are reshaping the workforce. The first one is that our workforce is shrinking, not because people don't want to work, but because of simple math. The population is aging, retirements are accelerating. Second, there's a shift in attitude. People are rethinking about the kind of work that they want to do, where they want to do it, whether it's in the office or it's remote, and who they want to do it for. And it's not that people have lost their work ethic, they just may not want to work for you or me. And third, we're living in an age of choice with turnover that's hovering around so high, and so much of that, the majority of that being voluntary. People are exercising more choice than ever, and so our mindset has to shift as well. We're not just hiring people, We need to be thinking about selecting partners. And it's just like on the kickball field, no one wants to be picked last, right? We're inviting people to join our team because they align with our mission and our values. As I said before, they're selected, and even more importantly, they're elect. They are the elect. So I want everyone here who's with us today to just take a quick moment to reflect. Do you believe that people want to feel valued? Do you believe that people are inherently trustworthy, that they're eager to work, they're responsible? Do you believe that they're accountable and genuinely want to grow personally and professionally? Now ask yourself, do you not believe that? Oftentimes I ask that question in rooms, and you see a number of hands that raise that believe these things, but then there are some honest individuals who truly do not believe that that's the case. Whatever the case may be, if we're being honest, there is a true disconnect now that's happening in many of our workplaces today. Somewhere along the way, our systems stop reflecting what we say we believe about people. There's an old saying that if you want to learn something new, read an old book. And so I revisited thinkers like Frederick Taylor, Henry Gantt, and Douglas with The Human Side of Enterprise, the book entitled The Human Side of Enterprise. They introduced ideas like Theory X and Theory Y, where Theory Y sees people as self-motivated and capable, while Theory X assumes that people need to be closely managed and controlled. And sadly, many organizations still operate in that Theory X mindset, especially towards their frontline workers. And a recent UKG study revealed how frontline employees are often viewed, how they feel that they are being viewed. Interchangeable, as less strategic. These people reported that they felt like that they were viewed as a different class of people, that they were even less knowledgeable. And we hear things like, you have to come help us, it's a mess. And when we look deeper, we saw the divide. Salaried employees are called knowledge workers. And so what does that make everybody else? Does it make them unknowledgeable? The truth is, the way we think about and treat our frontline workers are going to determine how well we weather the workforce challenges that are coming, the ones that are ahead of us, because that's where the real struggle is truly going to be coming. Across multiple studies, from Press Ganey to Gallup to the CDC to UKG and others, we've identified that there are essentially 4 types of people in today's workforce. They're either declining, they're either surviving, they're either growing, or they're thriving. Declining employees, they're checked out. They're clocking in, they're taking a break, they're disappearing. Survivors stay because they have bills to pay, but not because they find joy in the work. If a better opportunity comes along, they're going to move on. Growing employees, they see the potential, they're on the fence, but they're not quite sure. They're a little bit closer, but they're still not quite sure, just still evaluating things. And those who are thriving, those are ones that can't imagine working anywhere else. The problem is it's easier to move down that ladder than it is to move up, because negative experiences often outweigh the positive ones. But what's really interesting here is that what we're seeing is that approximately half of the workforce right now in the United States is stuck in that decline or survival mode. And the big reason why they're there, what their priority is to feel valued, or there's a sense of, or a desire for a sense of dignity. On the other side, growing and thriving, which is about the other half, what's important to them is meaningful work. But what we really want to illustrate here is that it's very critical to acknowledge that we have a workforce, approximately half of a workforce that is not feeling valued. They're not feeling a sense of dignity. So here's a quick snapshot of the roughly 160 million people working in the US. Half are frontline. These are the people that oftentimes feel they're not valued. These are hourly paid employees, and alarmingly, 1 in 5 say they're not treated with dignity. They don't feel valued in their roles. And that's not just a statistic, it's a warning sign. So we've got frontline employees who are saying roughly 20% of those are saying they're not feeling valued. To further underscore where we are today, Press Ganey recently released its latest report. You all may have seen this, Healthcare Employee Experience in 2025. This was based on input from almost 2.5 million healthcare workers across the country. And the findings are very clear that employee engagement is declining nationwide, and there's a need to build trust within teams and across systems. And this has truly, truly never been more urgent. What we're seeing in this report that Press Ganey is sharing with us is that engagement is slipping, and it matters. In 2024, engagement declined slightly, but even a small drop can have a huge impact. Disengaged employees are nearly twice as likely to leave, especially those that are early in their tenure, specifically those maybe who are in work less than a year. While turnover did improve a bit from 20% to 18%, according to Press Ganey, falling engagement, especially among those frontline roles I mentioned a moment ago, could reverse that progress moving forward. We're also seeing that advanced practice providers and physicians are feeling the most strain, which is not really surprising, with many reporting that they don't feel heard. Safety culture has also stalled. Fewer employees believe that organizations truly care about their well-being. And teamwork is emerging as a critical factor. Nurses with poor teamwork scores are significantly more likely to leave. Millennials and Gen Z are also reshaping our expectations. They want growth. They want to feel included. They want strong leadership. And here's the key takeaway. People don't stay because of pay. They stay because they feel trusted, valued, and they like to belong. Turnover isn't just disruptive, as my son would say as I shared this slide with him. It ain't cheap. It's expensive. Replacing, as we all know, a single salaried employee can cost a business 6 to 9 months of that person's salary. And the costs go up depending on the role. Hourly workers averages around $1,500. Technical positions, it can be 100 to 150% of annual salary. Executive level roles, C-suite positions, it can be up to 213%. It is expensive turnover. And so at the heart of the LEOS framework that we shared with you today, it's a very simple but a powerful idea. We have to rethink how we look at our operations in a way that's meaningful and relatable to everyone in our workforce, not just those who are in our leadership or in administration. And that starts with simplifying the way we talk about what we do so that every person at every level can see where they fit and why they matter. And the first place we have to focus on, as Leah shares, is people. Because if we don't get the people part right, if we don't create a place in our organization where everyone feels seen, heard, and valued, there is no amount of strategy, there's no amount of technology or process improvement that's ever going to stick. People isn't just one piece of the puzzle, it is the foundation. So if we do not address this challenge, the challenge is going to define our organizations. I've had the privilege of taking you through the dark tunnel about where we are with our workforce, but it's my privilege now to introduce Dr. Regina Ganey, who is going to share what we call an example mastermind. It's an approach that we have deployed within multiple organizations and health centers that's designed to create spaces where people feel valued, where they feel supported, and where both personal and professional growth is truly nurtured. So without further ado, I am happy to introduce Dr. Regina Ganey.
And
Hello, I'm
Dr.
Regina Gain. Can you hear me?
We can hear you now.
Okay, good. I'm
If
Dr.
you could
Regina
turn on
Gain.
your video, that would be great as well. Sorry to interrupt.
Yes. Okay. It's saying it won't start because the host can't start the video.
Okay. Yeah,
Mhm.
just mention that.
Now it seems. Okay, now we're ready. I'm Dr. Regina Gainey. First, I would like to say good afternoon to all of you. And I'm here to do a short mastermind for you. And it's entitled There's More to Me Than What You See, the Picture Perfect You. And I hope everyone is doing okay today. The first question I would want to ask is, how do you see yourself? And I know that's a random question, but when you really think about it, it brings up so many emotions in you. How do you see yourself? Do you realize today that there is a side of you that hasn't been seen yet? People don't even know you. I'm talking about people that you see every day, people you work with every day, don't even realize who the real you really are. In the picture that we have seen, that the cat paints itself as a lion. Why? Because that's how he sees himself. He sees himself as a lion, but what does people see him as? What happens? I need to know that what happens when you give someone else your brush, your paintbrush, for them to paint your picture. And for years, they have painted your portrait, and you have become, listen now, you have become their version of you. But you know deep down on the inside that there's so much more to me than what you see. See, and I like this because it's not just what I do. It's not just what you do. It's what I am. It's what I dream about. It's what I prayed for. And it's what I survived. And I need you to think of your life today as a canvas. If you have a pen or pencil somewhere beside you, and most of us do, I want you to put that in your hand right now and just hold that in your hand while I'm giving this mastermind. And I want it to symbolize, I want your pencil or your pen to symbolize a paintbrush. And the paintbrush, it represents your choices. Some paint strokes are bold, you know that. Some are hidden, some are intentional. But what do people see about you? And what do you see about yourself? What is still invisible? I want you to really think about these things. If your paintbrush could speak, what would it say? What would your paintbrush be saying about you? Are you painting for yourself? Or are you painting someone else's picture of you? We do that so often. Have you ever handed your paintbrush to something external, like your job, like your title? And some of us even hand our paintbrush to the trauma that we have experienced in life. If people would see the real you today, it would probably shock them because they would not know all of your aspirations, all of your dreams, all of your ideals that lives on the inside of us. But because we have handed over our paintbrush, they have never been seen. And now we're not casting the blame on anyone because guess what? We had the paintbrush first. We had to hand the paintbrush over. You see, they have seen the highlight reel, and you know what I'm talking about, the reels on social media. They have seen all the highlights that you could do. They've seen your job title. They've seen the version of you that performs. But what about the version of you that creates? What about the version of you that questions? What about the version of you that struggles? And what about the version of you that dreams? It is easy to fall into autopilot. Think about what it would look like if you really, really had the brush back in your hand. Now, I want to present some questions to you. And if you would, if any of these questions resonate with you, please answer them in the chat. What part of you is working the hardest right now, but nobody notices? What do you carry silently that others assume that it's easy for you? If people only understood or knew one thing that you don't say out loud, what would you want them to understand? Because listen, we are praised for what we produce, but rarely asked how we're really doing. Because if we're asked how we're really doing and we really let that out, people will see the real you and they will be amazed at who you are. I implore you today, really, to put that paintbrush back in your hand. Some more questions for you. What part of your identity feels like you're wearing a mask? What have you learned to hide because it didn't fit the setting? Where do you feel pressured to be more polished than present? I like to say here, I'm Regina Gainey. I'm Regina Gainey all day long. From the time I get up to the time I go to bed. In my dreams, I'm Regina Gainey. So I stay true to who I am. But that's only because it was a time in my life that I had to take my paintbrush back. I had given mine over. So I'm not talking just to be talking, I'm talking from experience. I had given my paintbrush over, and someone else was totally painting my picture, and I was living it out. But I was not being the real me. Listen to me real good today. What part of your canvas is still blank? It's a blank part of that canvas where nobody is seeing. I'm going to continue with the questions before I close. Who or what has influenced the way you paint your life? Are you making intentional strokes? Are you reacting to demands of others? Where are you painting from? Are you painting from duty or are you painting from desire? What part of your canvas, is still blank because you haven't made time for it? Because we're told to show up. That's what we're always told. We're told to show up, but not always told that we can show up as our whole self. So then, if I'm not showing up as my whole self, what is getting left out of my painting? Oh, I know you understand today. And we talk about this balance thing, but balance doesn't always mean doing less. It doesn't always mean doing less. It just means doing the right things with more care. That's all it means. It doesn't mean doing less. It means doing the right things with more care. Masterpieces take time. Y'all know that. They're not done overnight. Masterpieces take time. But guess what? So does people. Being in progress, being a work in progress, is not a failure. It's called being alive. So I implore you today to take the paintbrush back and put it in your own hand. Your canvas is not finished. Your portrait is not finished. You are not finished. Keep painting, people. Keep painting. Because guess what? You and only you. I'm going to say that again. You and only you. Can I say it for the third time? You and only you can paint the picture perfect you. I am Regina Gainey, Dr. Regina Gainey from Corporate Transcendence, and I hope you have enjoyed this mastermind. Thank you so much for your time.
Thank you, Dr. Gainey, a good colleague and friend of mine. We shared this with you all because we really wanted to illustrate again, just to tie everything together with what Pam had shared about the value of focusing on people first in the LEOS. People being one of the pillars or trees of transcendence, it being the first and foremost, it's being foundational. And then, of course, the dark tunnel that I brought you through in terms of the workforce, the state of the workforce today. These masterminds that we conduct, what you just saw, a brief demonstration of from Dr. Gainey, is a very, very powerful tool in a way to engage our colleagues in a different way, both heart and mind, we like to say, to create a space where people truly do feel valued, they feel a sense of dignity, they feel that the organization that they're working for truly cares about them. And for the message that Dr. Gainey conveyed today, if we were to envision a workforce that was empowered by that message, a workforce that hears and believes this message, what amazing work we've accomplished as a health center movement, but what greater works we could do in the future as a family of community health centers. And so, Dr. Gainey, thank you for sharing that. And with that said, I will turn it back over to our colleague, Pam.
Thank you, Chris. Let me get that right. Thank you so much, Chris. And if anybody, we may have just a few more moments for any questions or any conversation or thoughts or any point that's been made during our session that you'd like clarification more around. We're happy to entertain that. And thank you so much for allowing us to share today.
Thank you so much, Pam, Chris, Dr. Gainey. Dr. Gainey got me snapping over here with those questions. I do notice that in the chat it was asked if those questions that Dr. Gainey asked us to reflect upon could be shared in writing with attendees. So is that a possibility?
I know she'd say yes. If she's on mute.
Yes,
absolutely.
Yes, we will share those.
Thank you so very much. We appreciate that. And we encourage if there are additional questions, what are your thoughts on, we do have a question. What are your thoughts on incentive programs for employee retention?
Well, I'll take that. There's a lot of incentives ways to do incentive. It's not always necessarily money. It can be money. There can be a company-wide corporate goals that can be looked at, and with key things in people, quality, finance, and governance that might be looked at. And if we score these, there may be some type of incentive throughout the organization. Typically, for a lot of providers and in the different areas, there is certain goals and things they are asked to achieve, and if they make them, there is an incentive. But I have found actually that the valuing of the people really is the engagement factor. It's really helping to grow and develop the people outweighs the monetary or the pizza party or whatever may be coming their way. Now, there's nothing wrong with pizza parties and all kinds of parties, but I would say a organization that commits to investing time, energy, and effort into doing, like the example we saw today with masterminds, with ways to, and there's a model for that, right? Under people, how we do that, and empowering people to grow and develop and be the best they can be. But incentives are fine, but we're getting away from pay them more money, to get them to stay. People, when you're not engaged with your work life, then no amount of incentive is going to make a difference, is what I'm saying.
Thank you for highlighting that point for us. Another question is, how might an organization assess where they are in terms of leading organizational excellence? How might they self-assess?
Well, I would definitely, there is a organizational assessment that can be done that really hits on the different points, and I'm happy to share that out when we share out the other information with Regina that you could take back to your organization and answer those questions. You will see it's very people oriented. as you may guess. So, but that will tell you where you're at and where you need to focus at, as far as in your organization, and having highly engaged workforce. But I'll be happy to send that out. It is something that has been cultivated through corporate transcendence and Commonwealth Health, because we're almost one and the same. And we use that tool a lot and given that tool out a lot. Happy to give it out.
Thank you so much for that. Another question is in a workforce where employees are being more cautious and allowing for work-life balance, how do you recruit with that in mind? Sort of second part to that are part-time positions becoming more necessary?
It really depends on the type of work environment you have. The first thing we got to focus is on the people within the organization presently. And I believe when you increase the engagement and the satisfaction of the employees, that you will see that you don't need as many part-time people. I know with the workforce shortages and things like that, there are some dynamics that can come into play there, right? By far, and without specifics, it's kind of hard to answer that. But I will say that retention of your workforce is what you want. You want to, as Chris says, we want to select great employees. We want to grow them within our organization, value them, and we want them to stay with the organization. So there's great succession. And we want to grow those leaders from the front line all the way up to different positions throughout our organization. I like to say, mine for diamonds in your backyard. They're already there. But as Dr. Regania was saying, you may not know they're there. And they're already there. And so I can't tell you the amount of people. The more you pour into people, the more people want to go back to school on their own without you paying their tuition. It's amazing, and empowering them to do exactly what Dr. Gainey just did. There's people in the organization that can do those masterminds, do things that would help encourage and build people up personally and professionally. And work-life harmony is what I like to call it. There's a difference in working hard and enjoying what you do, and working hard and dreading to go to work the next day. So what we want to do is, work hard and play hard. But the bottom line is, you may be tired at the end of the day, but you feel valued and appreciated as an employee in that organization. You are valued truly for who you are and what you bring to the table, and you feel it each and every day. Guess what? It's called the good tired. I'm tired, but it's a good tired, and I want to come back to work tomorrow. That's why people's must come first.
I can see by the audience reactions that you got a lot of co-signers on that. So thank you for that reply. Another question, organizations acknowledge that employees are their biggest assets, yet some people, especially on the front lines, feel like they're treated as liabilities to be managed. How do you change that as an operational leader?
Right. It really comes together with it cannot be, just like LEOS is a very intentional leadership model. There's also a workforce intentional model. So having, sometimes the guest speaker comes in and everybody feels great for 2 or 3 days, and then it's kind of like, woo, like that. So the model has to be one that is sustainable, intentional, and will continue to become an organism of itself within the organization. So there is a people model. And the people model has to do with something, I'll share a little bit about it, that we've done at Commonwealth Health, is where we actually invest into our people and grow them. We have different levels of this that they go into. Guess what? It's all voluntary and nobody gets paid any extra. And it's been going on 15 years and we still have people signing up every year. So is it doable? Yes, it's doable. And you will not believe the payoff for it. If you really want great finances, if we really want good quality of care and great surveys, then invest in your people. And so if anybody would like to learn more about that system, that model, I'll be happy to share that with you.
Thank you so very much. Key takeaway, people first. That when you start there, everything else, if you're intentional about that, then your organizational success uh, it can only go up from there. So thank you so much for highlighting those key points for us from this discussion. Uh, I certainly want to thank you, thank Chris, Dr. Gainey for helping introduce us to the LEI system and leadership excellence operational system and helping us to focus on those key areas of people, quality, finance, and governance. Really very much appreciate that. We've set aside some time now to allow you, our audience, to be able to discuss what you've heard in this session in breakout discussions. Uh, we've set aside about 30 minutes for you to go into the breakout, and in the breakout you'll get some further instructions. But really, we've set aside some time for you to be able to connect with your colleagues in a small group, get to meet one another, and start conversations based on what you've heard today. We understand you could probably talk for hours, right? But we encourage you to take a moment, introduce yourselves briefly, exchange contact information if you want to do that, so you can follow up and continue the discussions after the breakout groups discussion. So you can see your Zoom link for the breakout group here. Again, that breakout group will last for 30 minutes, so you'll have until about 1:45 p.m. Eastern. I believe that's 10:45 a.m. Pacific time, after which we'll have a break for 15 minutes, so you can enjoy a brief break, and then we'll be back here at 2 o'clock Eastern time, 11 a.m. Pacific time, to resume our discussions on effective intergenerational communication. So click on the link to head over. I believe it may also be in the chat. So please click on the link and join us in the breakout rooms. We'll see you over there shortly.
Great. To confirm, the link is displayed on the slide and it is also in the chat. If you have any technical difficulties, come back onto the Zoom webinar and you can send us a chat and we can help you out. But see everyone back at 2 p.m. Eastern, 11 a.m. Pacific.
Hello, friends. We just closed out the breakout rooms.
Perfect, Sydney.
Awesome. I see lots of folks rejoining us after break and after those breakout groups. So I hope you enjoyed those conversations and hopefully you're able to take a little break away from the computer screen as we come back to our next session on navigating intergenerational communication. So awesome. I think we're just going to wait another minute or so before kicking it off. And I just want to provide a reminder for folks that doing these word clouds just to engage everyone and hopefully make you feel like we're in the same room together. We're able to talk, even though this is a Zoom webinar. We're all across the country and potentially in different countries as well, as I heard from a few of our participants. But our question for you all during this afternoon is, what is your top priority for your workforce? I saw quite a few people respond during the break, so thank you so much for checking that out. The Mentimeter link is in the chat, and as always, you can also scan the QR code on your screen with your cell phone. But a few folks did respond with retention being the largest word, which I know many of you are dealing with, and hopefully we'll be able to tackle that in our afternoon sessions as well. Some of you also said engagement and community engagement, training, preventing burnout, quality of care. I see well-being, which we were able to discuss a little bit yesterday. Awesome. So feel free to continue to respond to this. We'll share it during the next break as well at 3 p.m. But from here, I'm going to pass it off to Sydney Axelrod to present her session. Awesome.
Thank you so much, Megan. And thank you everyone for coming back and for joining us for this session. Let's see, give me one moment while I get set up here. I'm going to go ahead and start sharing my screen. Let's see. Okay, back the tape up a little bit here. All right, so we should be good to go. Excellent. Thank you all so much. I'm really excited to be here today to talk with you all about navigating and enhancing effective intergenerational communication. We know this is a topic that is relevant to probably everyone in this room, and we've been getting a lot of requests for some support around this subject at the Star Center recently. So I'm really thrilled to have this opportunity to get into it a little bit. Just as a reminder before we get started, I really encourage you all to use the chat, to use the Q&A function, share your comments, share your questions. As I say before every presentation, the only silly questions are the ones that go unasked. So really want to make this as meaningful as possible for all of you. And with that, we'll jump right in. I am here today, as you probably know by now, on behalf of the Association of Clinicians for the Underserved, or ACU. We were started over 25 years ago by alumni of the National Health Service Corps, and really have a lot of wonderful programming, all focused on supporting the brilliant workforce that provides care at health centers. So we've got a ton of resources around recruitment and retention, lots of other wonderful programming. Really encourage you all to check out our website and see how we can support you in your work. Specifically, I am here as a representative of ACU's Star 2 Center. Star Center stands for Solutions, Training, and Assistance for Recruitment and Retention. We are funded through the Bureau of Primary Healthcare, and we are part of a national cooperative agreement that we were first awarded in 2014. So this is our 11th project year. And we are one of 22 national training and technical assistance partners, or NTAPs. If you're not familiar with the NTAP program, each of the 22 of us have a specific area of expertise. Ours at the Star Center is all things workforce recruitment and retention. And the beauty of this program and the way that we are funded, all of our resources, our training, our technical assistance is all free of charge for you all to access. So here is our website, chcworkforce.org. I encourage you all, not in this moment, but at another time, to please go take a look, poke around, and see if there's anything that might be useful for you there. And if you have further questions, want to go a little bit deeper, please reach out to us. This info actually goes to a real person. It goes to me. But on the next slide, I'll include our team's email addresses as well. So please don't hesitate if there's any way we can support you in your work. That being said, this here is our lovely Star Center team. And again, all of our information is here. And so you will receive all of the slides in about a week's time. And please feel free, capture it right now. Reach out to it with all of your recruitment and retention needs. We are here to support. All right, so let's get into it. Our learning objectives for this session here today are threefold, right? We're looking to increase awareness and understanding of the generational traits and distinct needs in the workforce. We're going to spend a little time considering the context and the preferences of an intergenerational workforce and the impact of those needs on workplace communication. And then lastly, we'll get a little more specific into it and think about exploring some practical techniques and strategies that hopefully you all can take back with you and use for really leading effectively and communicating effectively across all of the generations in your workforce. So we at the Star Center, if you were here yesterday, you might remember this slide from my lovely colleague Tanya's presentation, but I've included it again here because this really is the core of how we approach all of our work at the Star Center. We really believe workforce is the fuel. If you have no staff, you have no health center, right? And so a health center who has a full tank is one that identifies workforce as an essential organizational issue. And beyond that is really making strides to invest the appropriate operational and staffing resources to support that workforce. It's really at the heart of everything we do. And when we think about that workforce and what that looks like today, there are several generations represented across all of our workforces. There are 5 that I'll briefly walk through here today. Just to give us some level setting and some framing about sort of what we're talking about when we're talking about generations, right? Right now, we're looking at traditionalists being sort of the more senior generation in the workforce right now. Those are folks who are around 79 to 96 years old. We know there are some of them still doing amazing work. After them, we have what we call the baby boomer generation, right? Those are folks between 60 to 78 years old. And then we have what we call Generation X, right? Those are folks who are about 45 to 59 right now. After that, we have millennials, those who are between 28 and 43. And then lastly, we have Generation Z, the newest members of the workforce, and those are folks who are 27 years old or younger. For the purposes of this presentation, I'm really going to focus on the sort of the bottom 4 of these. We're not going to go too much into anything about traditionalists, but I do want to name that some of them are absolutely still working and still doing wonderful things in the workforce. Really, this slide is to just get us all grounded in sort of what and who we're talking about when we're talking about an intergenerational workforce. So I want to hear from you all. What are some stereotypes that you have heard about your own generation? This could relate to work, this could relate to just life, but start throwing some things into the chat if you are comfortable doing so, right? What's a stereotype you've heard about your own generation? While we're thinking, I'll give you an example just to sort of kick things off. I am a millennial, and a stereotype that I hear about my generation is that we are all entitled because we all received participation trophies as children. So that is something I have heard. Thank you so much, everybody popping into the chat. That Gen Z is lazy or entitled, a lot of lazy, entitled, too young. That Gen Z, the Z in Gen Z is for zombie. Yeah, these are all very real. I hear a lot of these things as well. That Gen Z doesn't want to work, right? They want full-time pay for part-time work. Yes, that we don't own homes as millennials because we spend too much on avocado toast. I have certainly heard that one. I'm here to tell you it is not true. I am allergic to avocados and I still can't own a home. So do with that what you will. Please continue to keep thinking about those. I really just want to get our gears turning here around thinking about what this really looks like when we start stereotyping generations, right? Gen X is too stubborn. Yeah, we hear these things a lot, right? And as you're thinking about these things that you've heard, I really want you to start thinking about how that makes you feel when you hear those things. What does that make you feel about yourself, about your colleagues, when you hear stereotypes like that about your generation? Spoiler alert, generational divides are far more manufactured than they are real. And there's research to support this, right? We hear all the time about this great generational divide that exists. And the reality is that's not necessarily true, right? That's more of a narrative and an idea than it is anything based in reality. right? So when we look at generations in the workforce, right, what we're actually seeing, this is a quote from Jennifer Deal from the Center for Creative Leadership, right? And she says that companies invest millions of dollars in training and development because they have these beliefs about generational differences. They do that because they believe those differences are true, even though the evidence does not support those beliefs, right? Another couple quotes for you here. These come right from the Society for Human Resources Management, or SHRM, right? We really need to be careful about putting generational research in general, because what it does is it puts people in a box, right? And really, the heart of it, the key to understanding someone's behavior is to look at the individual, right? And the best way to find out how to motivate and engage any individual human person is to ask them what matters to them, right? Putting people into boxes sometimes helps our brains make sense of things, but rarely, if ever, is it actually a productive and helpful tool to help us reach our goals, right? No group is a monolith, right? Whether we're talking about generations or other ways that we can categorize people, no two people are the same, right? No two people have had the same experiences, have the same view of the world, right? So when we start putting people into boxes, even something like their age or their generation that might seem more innocuous, right, than other boxes we could put people into, we're really doing ourselves a disservice, right? And we're really setting ourselves up to lose sight of those individual needs. So I want to drill down into this a little bit more specifically, right? Because obviously, if we are all coming from different generations, we've all had different life experiences, right? There are very real differences between somebody who is 25 and somebody who is 75, right? They've had different life experiences. But there's a really important distinction to make here between differences and stereotypes, right? These are two distinct buckets of things, right? So when we think about things that are differences, either between or amongst a group of people, right? Differences are things that are nuanced, right? Differences are things that allow space for us to acknowledge and respect individuals, right? And differences are things that we can observe, right? They're things that are driven by more objective thinking, right? Differences exist. That's what makes the world go round. We're all different, right? But this is, again, an important distinction between what is a difference and what is a stereotype, right? When we start stereotyping people based on some group we've assigned them to belong to, right? Doing so is harmful, right? Stereotypes are harmful. Whereas differences can leave space for nuance and individual circumstances, stereotypes do not, right? Stereotypes are generalizing of an entire group of people and ascribing some type of trait or characteristic or what have you to an entire group of people, right? Which we know rarely is true. Stereotypes can have some really harmful consequences, right? They're used to alienate folks. They're used to promote division between groups. And at the end of the day, stereotypes, as I've mentioned, really lean into this all or nothing thinking, right? And all or nothing thinking is not going to be a helpful framework for us to think through the nuanced and intricate challenges of having an intergenerational workforce, right? So again, I think this is really important. We're not saying that differences don't exist and everyone's all the same, right? Because that's not true. Differences absolutely exist. But differences are not the same thing as stereotypes, and stereotypes do not serve us well to meet our goals organizationally or as people in the world, in community together. So as we're thinking about our workforce and what it looks like right now, I think it's really important to take a step back and really think about what are those differences between these generations, right? Not what are those stereotypes, not, avocado toast or being stubborn or, millennials being set up to fail, right? Those are all stereotypes, all of those examples you all shared. So we know that those are not helpful, but what is helpful is to understand what the real differences are, right? Without that judgment, without that generalizing. Right? And what I have for you here is really an outline of some of the different kind of basic cultural experiences of these different groups of people. And this, just to be clear, is very specific to an American sort of United States experience of someone. And the things that I've highlighted here are really experiences that folks have when they're growing up, when they're coming of age, if you will, right? And it's really important to consider this because our experiences, how we relate to the world, what we see going on in the world around us, what the dominant culture of the world is when we're growing up, right? When we are learning how to be a person in the world, when we're learning what the world is, right? That is when our worldview is being formed, right? That is when all of our perspectives are being shaped in how we see the world, how we see ourselves within the world, and how we see, what our roles are within that context, right? So if we take, for example, baby boomers, right? They grew up in a world that was post-war, right? There was a big suburban boom. There was a lot of consumer culture, right, around purchasing and buying things. That was sort of the main predominant sort of cultural narrative that was going on, right? There was a lot of economic prosperity. There was a space race, right? All of these things were happening. We also see things like the civil rights movement, anti-war movements, right? These sort of more social movements that are taking place during this time. And all of these things are going to shape how somebody views the world, right? If we move along to Generation X, right, we see the rise of more working parents, right? We see sort of the prevalence of these latchkey kids. And for those of you who are not familiar with that term, those are children, growing up during this time who were born between 1965 and 1980, who had two or whatever their family dynamic was, either one or both of the parents in the household were working. And so those children would come home after school and let themselves into the home and entertain themselves for the afternoon, right? That's where the term latchkey comes from, right? And now we can look at things like technology and what is going on in the world too to inform our understanding of the experiences of people, right? And so for Generation X, when they were coming of age, when they were learning to understand the world, we're seeing the rise of cable television. We're seeing more prevalence of video games that are accessible and in the home. We're seeing the rise of personal computers that folks have in the home and access to that, right? We're also seeing a greater, sense of different people being sort of featured in the public space and in the narrative, right? People who look different, people who speak different. And then moving through millennials, right? Again, some of these things are world events that are happening. Some of them have to do with technology, right? For millennials, for those born between 1981 to 1996, really coming of age during the time of 9/11, right? And I can speak to this from my personal experience. I grew up in New York, just outside of the city. And so this was very formative for me. I think you talk to, anybody who was alive during that time, it was a formative experience for them. But I have a very distinct memory as a child of having a very clear sense and understanding that the world completely changed after that day, right? In ways that were hard to put your finger on, and also in ways that were very tangible, right? That now you couldn't go walk your relative to the gate to wave them off on their airplane, right? Everything changed. And again, if we look at the technology aspect of this as well, we're seeing for millennials now, all of a sudden, the folks who are kind of growing up during this time period have access to the internet. It is more pervasive than it has ever been. Social media starts to appear as a part of that landscape. Smartphones start to appear as well. So now not only do we all have access to the internet in our homes, but we have it in the palm of our hands, right? And just think about the difference growing up with access to a smartphone versus growing up, say, as a baby boomer, right? When that technology and that access to information didn't even exist, right? And you think about how different someone's experience might have been, just given these sort of external objective factors of things that are going on in the world, right? We move then to look at Generation Z, right? That's those who were born between 1997 and 2010, right? We see this sort of growing awareness and public conversation around mental health, around self-care, right? That was not a part of any of the previous generations' experience growing up, right? We see Generation Z living through a global pandemic, right? And that's a completely new experience that none of the other generations have had in shaping their worldview, right? And in terms of the technology piece, now we really have the very first generation that we consider to be digital natives, right? And what that means is that I like to think of this is my own personal framework, that Generation Z was sort of born and using technology and using the internet and using all of the technological tools was really like their first language alongside whatever verbal language they were learning to speak, right? They learned it all hand in hand, right? Whereas even one generation removed, right? Even just millennials, right? Learning technology, learning how to use a computer, learning how to use the internet, right? That was not our first language. That was a second language that we had to learn. Granted, we can see some of the differences here, right? Millennials are learning that second language while they're still developing, while they're adolescents, while they're teenagers, while they're in school, right? Whereas Generation X or baby boomers perhaps are learning this whole new language of digital communication at a much later state in their development, right? They're adults now, they're in the workforce, they're already learning how to navigate the world without these tools. I see a comment in the chat about encyclopedias. I love this. And in influencing somebody's role as a researcher using encyclopedias, right? That's a really great example of how different generations had different opportunities and tools available to access knowledge, right? So there's a very specific reason that I'm spending so much time on this slide and talking about these generational experiences, right? These are the things that really play in as factors to those generational differences we were just discussing, right? We have different, again, not stereotypes, right? But we are different because we have all experienced different things in the world. And that had to do with the world around us, right? Not who we are as individuals. So I think this is a really helpful starting point to really think when we're looking at, challenges that might arise around intergenerational communication in the workplace, really reminding ourselves that we all had wildly different life experiences from one another, right? And that's even true for two people within the same generation, right? Let alone across generations, right? I see somebody else making a comment about using a paper map, right? Another great example of like how, and just think from 1946 to 2010, how much the world changed, right? Just think about that for a moment. Think about the tools, the technology that's available, right? The cultural norms of how we relate to one another in society, the visibility of different sort of groups of people within society, right? There have been so much change and so many cultural shifts and technology advancements, right? Everything has changed, exactly, Sherry. So if we really like ground ourselves in that and keep that in mind, I think it creates a lot more space for us to really build that empathy, that compassion, and that understanding of one another, to really take a step back and say, wait a minute, this person that I'm struggling to get through to, that I'm struggling to effectively communicate with, they grew up in a completely different world than I grew up in, right? And I think that can be a helpful reminder for us sometimes. Another important concept that I really want to introduce here is how we as individuals come to form our beliefs, and specifically our beliefs about other people or our beliefs about groups of people, right? Because differences exist, but somehow, just as people, sort of a natural thing we do, we go from recognizing that there are differences all of a sudden to creating stereotypes, right? And so I want to unpack that a little bit and think through why and how that happens, right? What is it that's informing our beliefs around those stereotypes? And I hate to tell you this, but it starts with you, right? And so this is a really helpful framework. This is not anything new, right? This came from a text that was published in 1990, but I think it still holds water, right? We start over here on the left side of the screen with observable data, right? That is something objective that we have observed, that has happened, right? And then somehow we go from observing data to making meaning out of that, right? And so the first step there is we choose which data we want to look at, right? And sometimes we do this consciously and sometimes it's entirely subconscious, right? But our brains don't work that way, right? We're never taking in all of the factors, all of the complexity, all of the nuance, right? We have something that's observable and we condense that down into something that our brain can manage. So the data is selected, right? From there, we take that data and we make meaning out of it, right? And again, oftentimes this is a subconscious process to make meaning we reference back to things that we already know, that boxes that our brain can put things into that already exist, right? And when we're making that meaning, oftentimes what happens is we're assigning motives, right? So we're looking at one piece of the picture, we're assigning meaning to that one piece of the picture, and we're assigning motive to that as well, which is a really important piece here. And based on that sort of sliver that we have now focused in on, we start making assumptions, right? We start filling in the gaps, we start writing the story to make assumptions about what that data means and what those motives are, right? And based on those assumptions, then we start to draw conclusions. And based on those conclusions, we take action, right? So I just wanted to offer this all to you to really get us thinking, like, we don't go from like, I see something, I see someone do something, and I take action from it, right? Even if it feels like it happens that quickly, all of these things are happening in the meantime. And no one human person is completely, unbiased and completely objective, right? This is a very natural process that happens in our minds as we try to make meaning out of what we can observe. So bringing it back to the generational differences at work. You may have seen this coming from the way that I've been talking about this, but today's intergenerational workforce has far more in common than not. I'm going to say that one again. Today's intergenerational workforce has far more in common with one another than not, right? And this is true. It doesn't always feel like it, but it is absolutely true, right? If we look at what people want in the workplace, what people want out of their experience at work, we all really want the same things, regardless of our age, regardless of our life experiences, right? People want effective compensation, right? People want to do meaningful and mission-driven work, especially in this space, right? At your community health centers, no one is doing this work unless they are mission-driven, right? And that cuts across the board, across generations, right? People want to go to work every day and work with reliable and supportive colleagues, right? That doesn't matter how old you are or what year you were born, everyone wants that. People want to feel like they have room to grow. People want career development opportunities. People want workplace connections, right? No one wants to get up, go to work, sit isolated, not talk to anyone all day and go home. Maybe somebody wants that, right? They're probably not working at a health center. And people want secure work environments, right? People really want to feel safe at work. And there's research to back this up, right? I am pulling this directly from a study in 2023, the State of Organizations. Citations are right there if you're interested in digging in further, right? But if you take anything away from this entire 2-day summit, or at least from this presentation, this is what I want you to walk away with, that we have far more in common than we do different. So really, like, let's start getting the gears going, right? Is it generation? Is it a generational difference, or is it just context, right? Because the reality is everybody pretty much wants the same thing, right? They want organizations to cultivate respect, right? And a lot of people would argue that this really is the secret to teamwork and leading across generations, is to really understand what it is we all have in common, right? My professional background, my initial training is as a mediator, right? When you are sitting down as a neutral third party and trying to help two people to really work out their own challenges, right? And one of the core principles of mediation is really leaning into finding that common ground, right? What are the things that we have in common? Because there is so much more opportunity and power in looking at the things that we have in common than there is in focusing on the things that we have different, right? Because the reality is the things that are different about us are probably not going to change, right? And so really what's more helpful is to think about what we have in common, what are our common goals, what do we all want out of this experience? And that opens up an entire world for you to really start exploring how we can start making changes that really are effective and useful for everyone. So again, I'm not trying to say, these generational differences don't exist or it's not a problem, right? They do absolutely exist, right? Our generational differences exist, even though there's more that we have in common, right? The differences are still there. And the research shows that this is most often at work tend to emerge around some key areas. And maybe some of this will resonate with some of you. Maybe you see this every day in your work, right? But some of the main areas where we start to see these differences manifest are around the use of technology, right? And I think it's no mystery why, right? If you remember that slide we were just reviewing, different generations had different access and opportunity to be able to learn how to use technology, right? And so we see these differences tend to manifest a lot around the use of technology. We also see these differences arise around communication styles, communication modalities, right? And again, if we think back to all of the different experiences that all of the different generations have had, it makes sense, right? Because the way we communicate with one another has also completely changed over the last 50, 60 years, right? It's not just the technology and what telephones look like, right? It's the way we communicate with one another. We also see some of these differences tend to emerge around giving and receiving feedback. We see them sometimes around time management and different relationship and understanding to time and time management. We see this around the concept of work-life balance and the relationship that people have to that concept of work-life balance, right? But remember, we have to think about what people have been exposed to, right? What they have experienced in their personal life growing up and in their professional life in the workplace, right? And we also see some differences often around organizational structure as well. The idea of hierarchies versus more flat organizational structures, things like that, right? We start to see some of these differences. So they are real, they exist. But there are things that we can do beyond just leaning into what we have in common to really start meeting these different needs and kind of starting to try to bridge the gap of where these differences tend to arise. So when we think about the changing workforce landscape, and again, meeting the needs of our staff, really we have a multi-generational staff, right? And I just want to pause here. There's a reason that this entire presentation is titled Intergenerational Communication and not multi-generational communication, right? Multi-generational implies that there are multiple generations in the room, period, right? Intergenerational really means that across those different generations, we are working together and with one another, right? But there are multiple generations on our staff, right? And so we really need to start thinking about understanding those unique needs, right? Because again, we have all had unique life experiences and therefore have unique needs, right? And so some things that we can start thinking about around meeting the needs of this changing landscape are thinking about things like succession planning, right? Really being proactive about the actual demographic shifts in our workforce, right? We're thinking about retirement, folks who are leaving the field of healthcare altogether, right? And thinking about that sort of turnover aspect of things and how can we be really proactive and really prepared as an organization to meet the needs of this challenge of a shifting demographic of staff or just a shifting staff period, right? Thinking about effective compensation and really doing an assessment on this, right? Things like pay audits, things like pay transparency around salary ranges, right? These are all tools and things that are within our power to start doing, to start meeting the needs of our varied, workforce individuals, right? Thinking about benefits from a more comprehensive perspective, right? It's really, there's an opportunity here to be creative, to consider the unique needs of your staff, thinking about, beyond just your traditional benefits, thinking about medical care, paid family leave, continuing education, policies, right? Work-life balance, right? At the end of the day, regardless of your personal views on this concept of work-life balance, we all go to work and we all have a life, right? And so there is something to be explored here. And it is essential for all staff to really feel like they have the tools and resources available to find this balance that helps them healthy, keeps them well. I'm thinking about my colleagues Tanya's presentation yesterday on workforce well-being, right? And how important all of this is to the health and longevity of your workforce and therefore your health center, right? So thinking about things like scheduling, thinking about things like paid time off, right? How can we really find the right mixture of things to create this opportunity for work-life balance, right? And this is not an exhaustive list, right? This is just to sort of get us thinking about what is within our power. What are the things that we can do to start acknowledging that there are different needs and that maybe we need to take some steps to try to meet as many needs as we possibly can. So with that, I want to transition to thinking a little bit more about specifically what this looks like at work, how we communicate, how we manage conflict, and hopefully start building some skills and ideas around how to manage this more effectively. So get your fingers ready for the chat box. I want to hear from you. Why do you all think conflict happens at work? Why does it happen? I mean, we're all working towards the same goal. We all want to provide excellent care to our communities. We have the same end game. We have the same resources available. So why? Why does conflict happen at work? All right. Miscommunication times 4. Excellent. Burnout, not listening to teammates, feeling unheard, making assumptions. Absolutely, right? The real reality is there's not one reason that conflict happens, right? And if you ask people to think about what comes to mind when you hear the word conflict, right? Oftentimes you'll get responses like argument, dispute, yelling, war, violence, right? These are what come to mind when we think about conflict, right? The reality is conflict is actually a positive thing, and conflict is a natural and normal thing that happens as humans in the world, right? And really what matters is how we approach that conflict and how we choose to move through it, right? So conflict happens for a lot of different reasons, right? As we were just talking about, right? We all have a different, unique perspective and view of the world, right? I'm sure some of you have seen some of those like optical illusion pictures, right? Where some people will look at it and say it's an old woman, and some people will look at it and say it's a young woman, right? If anybody remembers that whole like white and gold or blue and black dress debacle of the internet several years ago, right? 2 different people looking at the exact same image and seeing 2 completely different things, right? Of course, we're going to have conflict, right? It's normal. It's a part of life, right? And it happens at work for a lot of different reasons, right? Miscommunication is a big one, which you all have rightfully identified in the chat here. Misunderstanding, right? Misunderstanding is often a result of miscommunication, right? Lack of, wanting to learn from others, not communicating expectations well, right? I love that one around expectations. There's a quote, I believe, from the Buddha that I like to say all the time, that the source of all suffering is misaligned expectations, right? And so not being clear on what we expect from one another is really like a good recipe for conflict, right? Conflict takes a lot of different forms, right? Sometimes it's a resource conflict. Sometimes there's 1 donut left in the break room and there's 3 of us staring at that donut because we really want a snack, right? And that's a resource conflict. There's not enough donut for people, right? Sometimes it's a simple miscommunication and there really is no conflict at all, but wires got crossed and information didn't make it where it needed to go. That's another reason that conflict happens. Especially, conflict tends to arise particularly when we are all feeling more depleted, right? If people are experiencing a great deal of stress, if their schedules are overwhelming, you're just trying to make it through the day, through the task, from one thing to the next, you're probably not going to have the capacity to bring your best self to a challenge when it arises, right? So thank you all for sharing these ideas. You're all correct. There are a lot of different reasons that conflict happens at work, but the good news is it's not necessarily a bad thing. And you have a real opportunity to lean in and leverage conflict as an opportunity for growth, as an opportunity to build greater understanding between one another, to uncover inefficiencies or gaps in information or service delivery, to make improvements, right? And if we really start shifting our mind to, a lot of people are very afraid of conflict. It's a really common sort of response, right? We don't want to argue. We don't want to yell. It feels uncomfortable to be in disagreement with someone, right? But if we really start challenging ourselves to view conflict as an opportunity for a really productive conversation, as an opportunity for growth, I promise you it will transform your whole relationship to all of your interpersonal interactions, right? This doesn't just apply at work. Right. And as we're talking about understanding conflict and why it happens, there's a really important component of this as well, which I think really speaks to this piece you were all lifting up around miscommunication, around unclear expectations, around some sort of like challenging personal communication styles that you are up against with some of your colleagues, right? Intention is not the same thing as impact, right? They are both real. They both exist. They are both important. They are not the same, right? So what do I mean here, right? Let's say I am a supervisor and I go to my employee that I'm supervising and I share a bit of feedback with them, right? My intention in sharing that feedback is to provide this person with as much information as I have, to empower them to make a change, because I really am invested. I care about this person and I want them to be the absolute best professional that they can be. And really my intention is I just want to support and help them, right? Once I offer that feedback, right, it kind of goes out into the world and then goes into that employee's brain. Their brain makes meaning of it. And that information has an impact on that person, right? And it might not necessarily be the same as my intention. The impact might not be, I feel so supported and championed, right? Sometimes the impact might be, I feel terrible about myself. I feel like I really messed up. I feel like I just got chewed out by my boss and, it does not feel nice, right? And there's a real disconnect there, right? But this is just a reality of human communication, right? When one person has one intention in sharing something or saying something or doing something, that action, that statement, whatever it is going to have an impact on the person on the receiving end. And it might not necessarily be in alignment with your intention, right? So this, again, is really powerful to just keep in mind and remind ourselves, particularly if something happens, someone says something to us, and it has a negative impact on us, right? Someone says something and it makes me feel terrible. I'm questioning myself. My confidence is down, right? It's really hard in that moment to stop and say, wait a minute, I wonder what their intention was in sharing that, right? Because I feel hurt. And so I'm going to jump to this place of assuming that their intention was to hurt me, right? And so if we really build this in to stop and pause and think about what's going on the other end of this equation, where someone is coming from, it really opens up a whole world of opportunities for us to avoid escalating a conflict, right? For us to avoid those sitting in those bad feelings, right? And what I really want to challenge you all to do, especially at work, and even more especially if you're a supervisor, but really this applies to everybody, is to really start making a habit of assuming good intent, right? Giving people the benefit of the doubt, right? Because at the end of the day, we all have our own challenges. We're all walking into work in the morning with who knows what going on in our personal lives, our family lives, out in the world, right? And you're never going to know what's going through someone else's mind. I promise you, none of you on this call here today are mind readers, right? And so really, if we start making a habit of assuming good intentions, it really can be powerful in shifting how we're communicating and interacting with one another, right? So I challenge you to reflect on how your work and actions are affecting the other person, right? Because this is not one-way communication, right? I have an intention in sharing something. It has an impact on that person. Their response has an impact on me, right? It's dynamic. It's continuously moving, right? And so some real tangible suggestions I have for you are to really back to the basics of our communication skills, right? Using active listening, right? And paraphrasing as tools to have a better conversation, right? Especially if you're feeling a negative impact of something someone's saying to you. Because, a lot of times someone says something, it's having a negative impact. I'm starting to have a reaction, right? My brain's going to shut down, right? I'm going to go to this place, make up stories in my head about what they meant to hurt me, right? And I'm going to probably not be listening very well to what they're saying, right? And so we want to pause in those moments and check for understanding and say, hey, listen, what I heard you just say was XYZ. Is that really what you meant to say? Because that's how I heard it, right? And that's the beauty of paraphrasing, a very simple tool that can avoid 95% of your miscommunications, to really just check your understanding with someone, right? If you're feeling challenged, right, before you're assuming that someone's intention was negative or that it was, directed at you, inquire to learn, ask questions, right? It costs you nothing to ask a question. It's just going to give you more information to make a better assessment for yourself, right? I see a comment in the chat that somebody's basic rule is to create an askable environment. I love that. I think that we should all take that advice to create an askable environment, right? Asking questions is going to help you learn more about the why before we just jump into the assumptions, right? And again, stress is going to make us a lot more likely to ascribe intention to somebody else's actions, even when it's not really there, right? And so we want to make this habit of checking our own bias, right? Avoiding some of those animosities that spring up when things get tense and are very high stakes, right? It's also helping us to think about our teammates and how our actions affect their jobs, right? Communications goes all of these different ways, right? So take a step back, pull back, and assume good intention. One of my favorite phrases that you should have in your back pocket at all times, especially if you find yourself having a difficult conversation, is help me understand, right? I want to understand. Help me understand where you were coming from when you shared this with me, right? Help me understand what your priorities are when you're making these choices, right? Ask questions, learn more. I had a professor in grad school that always used to say complexity is free, right? Situations are often a lot more complex than we're willing to admit. And the more complexity we add in, the more information we have, the more questions we ask, the better position we're going to be in to make good choices, to communicate more effectively. Again, conflict is normal. It can be an opportunity for growth. This is a very basic graphic that I'm embarrassed to say I think I put together in like Microsoft Paint a million years ago. This is an iceberg, if that wasn't clear, right? And so on top of that iceberg, above the surface of the water, that is someone's position, right? And that could be something like, I want a raise. That's my position, right? 10 times out of 10, underneath someone's position, they have underlying interests, right? And underneath those interests, they have underlying needs. And the beautiful thing about looking at it this way is those underlying needs, those are universal. That's where we can find our common ground, right? Everybody has basic human needs as a human on this planet and as an employee in a workplace, right? So the position might be, I need a raise, give me a raise, right? And that's all we're seeing on the surface. Underneath there might be an interest of, oh man, my child's school fees, increased by 10% this year. And if I don't get a raise, I'm not going to be able to keep my child in the school that they're going to, right? That's my real interest. My real interest is that I want to be able to pay for school, right? And underneath that interest, if we take it even a step further, is my need, right? My underlying need to be the best parent that I could be, the need to provide my children with whatever opportunities that I can, or my need for them to be in a safe school environment, right? So really like keep this in mind that all we're seeing on the surface is someone's basically like their stance on something, right? And underneath that, they have an underlying interest that you might not know about. And underneath that, they have an underlying need that you probably have too, right? And so let's ask ourselves, what kind of needs are not being met that has led to this conflict, right? This is where those why questions come in, because you're never going to be able to see below the surface of the water unless we create spaces either where people feel comfortable offering that and sharing it, or we ask really good questions to try to understand, right? When we're thinking about leading across generations, this is just another framework I wanted to share with you all. This comes from the Center for Creative Leadership, and they outline 10 tactics for leading across generations. And I think these are fantastic, right? Learn from one another. We all have valuable input to share, regardless of what our life experiences were. It might look different, right? Somebody who is from that baby boomer generation may know how to read that paper map, right? And somebody else from another generation might have another skill that's valuable, right? I really want to caution you to avoid stereotyping, right? I cannot tell you how many spaces where people think they're trying to overcome these generational differences and say, Gen Z is not all bad. They're really great with AI, right? Do we see the problem there, right? We're just perpetuating the same problem. Not everybody from Gen Z is good with AI, right? Not everybody who's a millennial is tech fluent, right? Not everyone who's a baby boomer is bad with technology, right? I have learned a lot of computer skills from people who are older than me in the workforce, right? Foster well-being. Again, we all have that need for well-being. Align on your shared values, show respect for one another, be a trustworthy leader, right? Stick to your word. And if you can't, explain why and be transparent in your communication. Promoting that supportive workplace, communicating changes. That's a really important one. No one likes to be blindsided by change, right? Really breaking down those silos. You can see a theme here really around effective communication across the organization and across groups within the organization, right? Doing the right things to retain your talent. Prioritizing learning, right? We all have an opportunity to learn no matter our age, right? I don't want to hear you can't teach an old dog new tricks. It's just not true, right? And build those teaching skills, right? So that we can all learn from one another, right? And really leverage the beautiful and amazing and abundant resources that we have under our own roof with our own staff population. Another framework that I just wanted to offer you all, just as an idea of thinking about navigating these generational differences. This is a 5-step approach, right? So the first is to acknowledge, to name it, to talk about those differences, right? You cannot solve a problem if you do not acknowledge that it exists, right? Appreciate, all right? This is where we focus on that why and not the what, right? This is where we lean into our common needs, right? The what is going to divide us, but the why is going to unite us, right? Flex, right? Agree on how to accommodate different approaches. Find that middle ground. It might require a little bit of give and take, right? Leverage, maximize the strengths of each generation, right? If you decide to roll out a new, digital tool, right? Figure out who within your organization loves that tool and is super comfortable with it. And do not assume it's the youngest person in the room, please, right? But then that person can help teach others, right? And it doesn't have to be in generational silos. It doesn't matter what your age is or when you were born, really just maximizing the skills that you have. The last step here is to resolve, right? Determine what option is going to yield the best results if flexing doesn't really get you where you need to go, right? Really thinking tangibly about moving to the future. I have the source of this cited in this slide. When you get the slides, please feel free to dig in a little bit deeper, but I just wanted you to offer you all like a really tangible sort of multi-step approach to thinking about this all. And it really ties into everything that we were talking about here today. At the end of the day, this is all communication, right? Communication is essential, especially when it's coming from leadership, right? What you say and what you do matters. How you say it and the actions that you take matter, right? Really thinking about practicing this bi-directional communication, creating a dialogue. Information should not be flowing one way downhill and that's it, right? Don't be dismissive, be open, listen, learn, adapt. Again, inquire to learn. We are asking because we genuinely want to learn more. Help me understand, right? And really take that strengths-based perspective. If this slide looks familiar, it was in Tanya's presentation yesterday because that's how important communication is, right? Really leaning into what's working well. What strengths do we have available to us under our own roof, right? And appreciation goes a really long way. Even if it takes you 2 seconds to send a Slack or a Teams notification or leave someone a Post-it note on their desk that says, you're doing great today, right? That is huge for morale. I just got one of those from my colleagues right before the session saying, you're going to be great. Have a great presentation, right? Do I need to hear that? No. Does it make me feel better and make me feel more excited to come and share this all with you? Absolutely, right? Those little moments really go a long way in supporting one another. Lastly, I just wanted to really hone in on the role of leadership here. Leadership has a real opportunity to sort of set the tone for the organization, and you really need to think strategically about how your leadership is reflecting your organization's goals in its day-to-day actions, right? The alignment of your health center's mission with the needs of your workforce is absolutely critical, right? Because again, if you have no workforce, you have no health center, right? I will leave you with that as my final thought for you to noodle on for the day. We have a few minutes left. I would love to hear your questions. Please feel free to put them in the chat or the Q&A. I see one in here. This takes time. If you're not a psychologist or a counselor, digging deep takes time. Thank you, Michelle, for calling that out. That is absolutely true, right? None of this is going to change overnight, but it is important and is worth the investment, right? A lot of this work requires the difficult task of self-reflection, right? And checking ourselves and how we're communicating and what we're bringing to the table. But it is worth it. It is a worthwhile investment. And I promise you, you will see the payoff faster than you think, and both in your workplace as well as in the rest of your life as well. I'm pulling this last slide back up, got a request to see that again. Folks kind of wondering how we create space for this in the business of the day, right? The day to day. It's a really great question, right? It's hard to think about like, how do I strategically, align our communications in a way that feels nice when I'm worried about, care delivery, right? It's very understandable, right? But this can be incremental. This can be small steps, and it starts with the individual, right? It starts with that level of self-reflection and saying, wait a minute, am I rushing to judgment when something has a negative impact on me? I cannot overstate the power of modeling effective communication, right? If you are in a position of any type of power within your organization, whether you're formal leadership or you just have some cultural juice within the organization, if you take the opportunity to show up differently, to show up in a way that is self-reflective, that is compassionate, that is patient, other people take note of that, right? And modeling those behaviors goes a really, really long way, right? Creating a culture where we can ask those questions, right? That is huge. Let's see. Just trying to keep an eye on the Q&A here. Somebody wants to know what role the board of directors plays in helping advance some of these operational strategies. Excellent question. I think whatever capacity, we're able to engage them, this really cuts across. And I think that that's really one of the benefits of thinking about this way, because it's twofold, right? It is empowering individuals to build these skills. And so that could be just even offering a lunch and learn on effective communication, right? That could also be like policies and procedures that we are institutionalizing, right? Around creating space to share appreciations, right? Or something like that. Creating, a quiet corner for people to have difficult conversations so that there's a place they can go and close the door and really create a space to do that, right? So there's a lot of different ways that we can think about this, but absolutely think about how your board plays a role in this. That is part of the leadership of your organization, right? And so maybe it's offering a training like this for them, right? So that they can understand what the power and the importance of this type of communication is, right? And really, I just challenge you all, we're going to continue to see some of these challenges arise around working with so many different generations in the workplace, right? And so if we really start confronting that head on, with compassion, with grace, with self-reflection, those small moments add up over time, and that's what creates culture change within your organization, right? So even just for yourselves, everybody here today, like, try to move yourselves out of this idea of stereotypes of all of the things we have different, and kids these days don't want to work and boomers don't know how to work their computer, right? It is not helpful, it's not productive, and it's not true, right? We all have a lot of value to bring to the table, and we really need to think about how we're engaging with one another, really leaning into the things that we have in common and really leveraging all of the amazing strengths that we have available to us at our organization. And with that, I believe we are right at time. Oh, my clock is a little fast. Any additional questions? I have a couple minutes left. If anyone has any thoughts or questions in the chat or the Q&A. And I'm just going to lift up a note from my wonderful colleague, Michelle, that your board should also have a mix of generations. Yes. So that this also directly impacts how they communicate amongst each other. It's really, that type of representation in your leadership is a very, very powerful thing. The more perspectives we can include around the table, the more life experiences, the richer our conversations are going to be, and the more effective our workplaces are going to be for everybody who works there. Oh, Michelle coming in at the last minute with the hard-hitting questions, an example of a difficult conversation, what went well, what did not go well. Everybody share that with each other. I have a lot of examples of that. I have spent a lot of time thinking about this, but I think those are excellent questions to leave you all with for reflection. So I encourage you all to think about that and really lean into like what we could do better next time, because we're never going to get it perfect every time. We are humans, right? So we need to offer ourselves some grace too, but as long as we continue to try, as long as we continue to learn, and treat others, with the same grace and compassion that we would want for ourselves, we're all going to be better off. So thank you all so very much for your time and attention. I really appreciate it. And I hope you enjoy the rest of our programming that we have today.
Great. Thank you, Sydney. Awesome. From here, we're going to start our break about a minute or so early, which is fantastic. So you all get a little bit more of a break. And as a reminder, during this break, you can be completing that Mentimeter word cloud on what is your top priority for your workforce. Again, I will put that link in the chat so you can either click on it on your computer or scan the QR code using your cell phone in the bottom left-hand corner. We will return at 3:15 p.m. Eastern Time, which is 11:15 a.m. Pacific Time for our, oh, I'm so sorry. 3:15 p.m. Eastern, 12:15 Pacific for our presentation on building training programs in health centers. So thank you all, and we will see you back in just a few minutes. Wonderful. And welcome back from break, everyone. We're going to dive into our next session, which is a panel presentation on building training programs in health centers. Again, it is 3:15 p.m. Eastern Time and 12:15 p.m. Pacific Time. And welcome back and thank you for joining us. So I have the pleasure of introducing this panel. I think it's going to be such a wonderful opportunity to learn about 4 unique training programs. I will point out that these will be quick presentations to share innovative training programs at health centers from across the country. So hopefully through this presentation, you'll be able to learn little nuggets of information that you can take back to your health center to see if it would meet the need of your health center, of your patient population, and of your community. From there, we can connect you to more resources or even to the presenters themselves if they're willing to. But again, the presentations will share the background and history for creating these training programs. So the program drivers, the process for doing so, gaining leadership support. The presentations will also include information about the program's core elements and the design, as well as the value and impact to the health center, as well as to the community and the patient population. In the next 60 minutes, you'll hear 4 presentations on medical assistant training program, nursing apprenticeship program, an apprenticeship program in a rural health center, and a postgraduate advanced practice registered nurse residency. And then at the end, we'll have time for audience questions and comments, and then we'll dive into our wrap up before heading into our final session of the day on strengthening emergency preparedness. So hope I can all center you in the next 2 sessions of this afternoon. As always, if you have questions or comments, feel free to either put those in the chat in the Q&A function. From here, I'm going to pass it off to my panelists to introduce themselves, just make sure their video and audio works before we dive into these presentations. So Anna, if you could go first, that would be fantastic.
Great. Hi, I'm Anna Patakin. I am the Director of Emergency Preparedness and Training here at the Waianae Coast Comprehensive Health Center. Thank you.
Fantastic. And Heather?
I am Heather Smith. I am a master's prepared nursing educator, and I am the clinical educator at Alluvian Health in Montana.
Awesome. And Jaquetta?
Good afternoon. I'm Jaquetta Gatlin, and I am the Workforce Development Coordinator for Roanoke Chowan Community Health Center.
Awesome. Thank you for joining us. And then Doug?
Sorry. Hi, everyone. I'm Doug Spegman. I'm an internist and chief clinical officer at El Rio Health in Tucson.
Awesome. And then also from El Rio, we have Jessica. Jessica, if you'd like to introduce yourself.
Hi, my name is Jessica Smith, and I am also at El Rio Health Center here in Tucson, Arizona. I am the APRN Residency Program Director.
Fantastic. Well, thank you all so much for introducing yourselves. And with that, we'll kick it off with our first presentation from Waianae Coast Comprehensive Health Center to present on their National Institute for Medical Assistant Advancement program. So passing it off to you, Anna.
Great. Thank you so much. Appreciate that. Well, first of all, aloha from Hawaii. For me, it's really about thanking NEMA, the program that we partner with, the impeccable staff that's there, and the colleagues that I'm very honored for the opportunity to present the NEMA program at the Waianae Coast Comprehensive Health Center. Okay. So knowing your past is a determinant to your future. You know, during Hawaii's sugar plantation era, the sugar company provided housing, schools, and medical care for its employees and their families. So for us, in 1948, Waianae Sugar Mill closed. The community lost a major employer and its access to healthcare. Residents were forced to drive 1.5 hours to Honolulu to see a doctor, and many times were denied care. So in 1966, 2 part-time doctors were in the community to service a population of about 18,000 people. Concerned residents at that time formed a health task force to develop a framework for a comprehensive health care facility. In 1968, a Model Cities program federal grant provided the funding to move forward. In 1970, the public held an election for its first health center's board of directors. Then in 1972, the doors were opened. 53 years later, WCCHC has grown with its community, and there is more to come. The future is in education and training, and the comprehensive will confidently venture forward with NEMA and our other training programs such as Elepayo Social Services, Hawaiian Cultural and Teaching Center, and the Education Institute Ke'ikeola. From inception of the NEMA program, the center determined alignment with our mission was essential for the program's success. As a teaching center, we understand our responsibility to our patients, organization, and community. We recognize Waianae is the largest community of Indigenous Hawaiian people with compounding health challenges and serious social determinants of health concerns. Through an integrated service philosophy, we actively collaborate with our partners to successfully reach mutual goals. Oh, next slide. Sorry, next one. Okay. So from this slide, like I said, from inception, the NEMA program was developed. The center determined alignment with our mission was essential. So as a teaching center, we understand our responsibility to our patients, organization, and community. And through that, we utilize not only what services we have at the Waianae Coast Comprehensive Health Center, but also look at the concerns and the main points of our community and the needs that are present. Next slide. So Kina Ole is a staff engagement and recognition program focused on striving for excellence with aloha. The Kina Ole core values represent a way of life professionally and personally to do the right thing at the right time for the right reasons the first time around. Kina Ole provides a performance pathway where optimal customer service, patient satisfaction, and quality care are the goals. Utilizing these core values, we are able to enhance the NEMA program through cultural sensitive practices that facilitate personal and professional development, which encompass NEMA and the comprehensive values for success. Okay. In alignment with our mission statement of being a wellness and healing center, a learning center offering health career training that contributes to economic development, and an innovator using leading edge technology, we identified community and center conditions and requirements to develop continuing learning opportunities, education and professional advancement, and economic and employment opportunities. To address and meet the identified conditions and requirements, we needed to acknowledge what we represent to the community and understand our purpose and value in the community, which resulted in the partnership between NEMA and the comprehensive. In collaboration, we incorporated the NEMA education program and teaching opportunity with perpetual intentions by expansion into different communities we serve, by assimilating into the center's satellite clinics, and increasing cohort participants. When considering organizational needs, we recognize many are conditional, which are associated with or dependent upon each other. The initial assessment focus should include areas of community interest in a healthcare career, which unlocks employment opportunities, resulting in financial stability and security. Career advancement, which presents staff opportunities for professional progression, which enhance employment satisfaction and retention. Professional opportunities for career growth or transition to facilitate longevity. And organizational operations, focusing on performance elevation, empowering improved productivity, and customer satisfaction. The board of directors and executive leadership commitment is required to successfully launch, maintain, and expand the program. Concurrently, earning all-encompassing support is imperative, from clinic operations, management, providers and staff, to community partners, patients, visitors, and family members. Identifying externship locations should incorporate the program's purpose and organization's needs. For us, when selecting clinic sites, we facilitate learning by rotating externship sites in alignment with academic lessons. Skill labs are in coordination with managers and follows an externship site rotation. This practice provides specialized support to students, which improve learning. Preceptors are program coordinators and site facilitators lifeline. For this reason, we train all clinic medical assistants to be preceptors to minimize barriers such as operations, schedules, staffing, and more. From our board of directors, executive leaders, participants, and community, NEMA's value at WCCHC is immeasurable. NEMA championed the comprehensive objectives to improve conditions of the Waianae people, community, and our organization. The program positively impacts the lives of its participant with career advancement, employment opportunities, and economic stability. NEMA provided the comprehensive with a vehicle to reach outcomes we would otherwise have difficulty achieving. After 6 years, the program has proven its longevity by year-over-year increasing of applicants across several communities. The NEMA program allowed us to create a direct recruitment line for medical assistants. Externship at the center provides opportunities for the student to learn about the comprehensive and the clinics to assess students for potential employment. Through the recruitment line, we address secondary objectives such as career transition, professional advancement, and employee retention. As an active partner, we direct efforts on workforce investments by providing students with the ability to balance their academic learning and clinical development to inspire a well-developed professional. Additionally, the comprehensive demonstrates its commitment through financial and operational resources and support. As a result, our investment return has generated and produced an annual increase of applicants since inception in fall 2019 of 2 applicants to this year's spring 2025 of 31 applicants, and the highest being in fall of 2023 of 48 applicants. Our graduates to date are from 10 cohorts. We enrolled a total of 57 students, including the spring 2025 cohort. We've graduated 35 students who are now NEMA alumni. Further proof of success is our graduation rate of 71% and a student alumni ratio of 7:5. The decision to embark on the journey to provide meaningful opportunities that could malama the lives of many is complex. Knowing one's purpose provides the direction to accept kuleana, to create the partnership to lokahi, and to overcome the challenges. The relationship we established in 2019 provided the ability to lau lima in achieving our goals. The outcomes we have realized through Ho'okipa. The future is bright, and together we shall continue to rocket our success to new heights. Again, I thank NEMA, this organization, and all of my constituents and colleagues for the opportunity to present the NEMA program at the Waianae Coast Comprehensive Health Center. Together, we will have success and it will be realized. Thank you.
Thank you, Anna. If anyone has any specific questions for Anna regarding their medical assistant training program, please put those in the chat or the Q&A so we can keep track of them for the end of all the presentations. Thank you again. From here, I'm going to pass it off to Heather with Alluvian Health.
Thank you. And boy, Anna, that's a tough act to follow. Your pictures are gorgeous. So hi, greetings from Central Montana. I I work for Alluvian Health, but I am here to talk about Next Nurse, which is a program of Alluvian Health that was created through an H-1B nursing expansion grant, U.S. Department of Labor. And though we are the recipient of the grant, Next Nurse is one of 7 employer partners within this apprenticeship model that we created. A little about Alluvian Health. We are a nonprofit FQHC. Like I said, we are in somewhat the middle of Montana, just east of the Rocky Mountains in the Little Belts, as they're called, mostly flat land and very dry. So not the Montana you have all seen with Kevin Costner. That's not where I live. Next Nurse started as part of the Cascade County Health Department, and we have a 30-year history. We have several locations in Great Falls, as well as Choteau, which is on the border of Canada, so just due north of us. We have mobile units for primary care and dental services. We started out, and the reason that we got into this is that we have hosted over 100 students for clinical experiences each year. The actual city of Great Falls is the 3rd largest city in the state of Montana. And we have, at present time, 3 nursing schools that sit within our county catchment. So we have a lot of nursing students that come through. And I'll talk a little bit about why we saw the need to do apprenticeship as an expansion model for nursing. We became a registered apprentice site with 3 programs in 2023. And we are just hitting the end of year 2 of our program. We, like I said, have 7 employer partners. We have 28 apprentices, and we have 4 registered apprentice tracks that we go through. Very quickly, the picture that you see here is the bottom left-hand side is our very first apprentice, Jessica. We brought her in. And this was her leaving us. Sadly, graduation from the program means that you move on. And so she had received her certified medical assistance licensure or certification, and she moved on and is working in cardiology. So next slide. Oh, thank you, Megan. Okay, so why did we need to do this? Like I mentioned, we have many nursing schools. What we found was that just because we have the nursing schools here in Great Falls, it was not helping us across the state find nurses. 89% of Montana is considered rural, and though we have several large pockets of population, for the most part, we have more cows than we have more people. So finding people to work in our critical access hospitals is very difficult. And when we bring young people and second career folks into the big cities of Bozeman, Missoula, Great Falls, to train them to be nurses, what happens is they get a taste of the big life and don't go back to the ranch. And that is what some of the farmers had told us when we talked to them about what was going on in their areas. And so what we needed, and if we look at the Venn diagram on the bottom, the employers needed nurses. They needed people who were interested in staying in the area. They were having more and more trouble finding training for their employees. Future nurses who need to work while they're going to school. Nursing school is very intensive. It's very hard to work. If you don't have a degree, it is hard to move on and get into a distance learning program, even though the COVID epidemic did bring about a lot of online and distance learning. It really doesn't help if you don't have a place to start. So we looked at some of those and then worked with the schools and said, what can we help you with? And what they were finding was they were having trouble finding clinical sites. They were having trouble with labor and operational costs by putting nursing instructors in these small community schools and that sort of thing. And so when we received the grant, we said, why don't we try and look at this as an apprentice model? Very much the way you train a plumber or an electrician. Why can't we train nurses that way? And we decided to start with a model that was replicable and measurable. It's a proven training method, and we can see a lot of expanded benefits, especially in our veterans and our WIOA populations. So what became of that is on my next slide, Megan. Great. So this is what we came up with. The Next Nurse program is an apprenticeship program where you start out with no experience as in healthcare, and you become an apprentice. The first step on the path is for you to become either a certified medical assistant or a certified nursing assistant, depending on the employer partner. What is it that you need? As a federally qualified health center, we are outpatient and we have a need for medical assistance, but we have partners, Bitterroot Health System in the Bitterroot Valley here. They have hospitals, long-term care, so they need some nursing assistance as well. Some sort of certification that gives you your baseline medical terminology, anatomy, and physiology is where you start in this program. And then you move throughout the program from there into an LPN program. Working with Great Falls College here in Great Falls, they have an asynchronous online part-time LPN program. So that program allows the students to go to school on their time. And one of the requirements of being an employer partner is that your apprentices must be paid for 10 hours of education each week, which comes out to 25% of their FTE. Part of the incentive of this is the DOL grant allows us to pay back that money to the employer. So they're not losing money on their productivity. They can bring in another person to cover that time that their future nurse or future MA is training. And we also have myself and several other nursing educators on site. We work as tutors and support and that sort of thing with our partners. Let's see, we can go to the next slide. There we go. So what does it look like? It looks like a future nurse gets a full-time job with benefits. They get paid time to learn. They get on-the-job training with structured instruction. We sponsor and help procure and train preceptors for all of them in their communities. So we're doing education not only to the apprentice, but also to the people who are supporting the apprentice in the employer programs. And the employer gets an employee pipeline. It has been helping with attrition. We have seen less rollover when it comes to people who start the program. They become an LPN, they stay in the program because they want to join to take a bridge program from LPN to RN. We did partner with a bridge program in this past year, and I'm happy to report that tomorrow evening, 6 RNs, former LPNs, will be pinned as RNs and are graduating. And we also have 2 LPNs who are coming to the end of their training, and they will be graduating as well. So we're very excited. We are increasing the numbers of Montana nurses semester by semester here. The schools are also finding that we are building a built-in learning environment with clinical access to educators. And I will follow with this, and this will be the end unless there's any questions, is that the program itself also is looking to increase nurse educators. And so our next steps are going to be to look at how do we bring more educators into the loop and into the process so that we can continue this program, moving more people through the pathway to an RN.
Fantastic. And Heather was kind enough to share their contact information. And if you have any questions for Heather regarding the nursing apprenticeship program, feel free to put those either in the chat or the Q&A. Awesome. From here, I'm going to pass it off to Jaquetta at Roanoke Chowan Community Health Center.
So again, I'm Jaquetta. Good afternoon. I'm Jaquetta Gatlin, and I'm the Workforce Development Coordinator here for Roanoke Community Health Center. And I just want to share how we have built an amazing workforce by utilizing apprenticeships. You can go to the next slide, Megan. Roanoke, who are we? So we are a federally qualified health center dedicated to providing high quality, affordable health care to rural and underserved communities. And we offer comprehensive medical, dental, pharmacy, and behavioral health services with a patient-centered approach that prioritizes accessibility and care. Next slide, please. Here are our 5 facilities. We have Ahoskie Comprehensive Care, Crestwell Primary Care, Murfreesboro Primary Care, Woodland Primary Care, and Colerain Primary Care. We serve all of Roanoke service area here in North Carolina. What is our commitment? So RCCAC is committed to fostering workforce development and advancing innovative healthcare solutions to improve overall community well-being. Through our strategic partnerships, which I'll share with you all, RCCAC not only enhances patient care, but it also plays a pivotal role in growing and sustaining a skilled healthcare workforce, which is what we all want. Next slide, please. The value of our apprenticeship and training, or having apprenticeships and training, is it creates skilled professionals for the workforce. Not only does it do that, it helps enhance our patient care, which we know that is top priority. Another flip side of the coin with that is our staff feels like that we care, which we do, and that we invest in them. Employees gain hands-on experience with mentor guidance, and staff is assigned directly to a preceptor. Career pathways improve retention and promote leadership growth. And in that preceptorship, it's fine, Megan, you can stay there. In that preceptorship, they actually get mentorship as well. So let me talk to you about our registered apprenticeship program here. At RCCHC, our program is not just training. We truly transform careers in training to the next generation of healthcare professionals. We have hands-on clinical experience, classroom instruction, and mentorship that helps provide skilled, confident, and dedicated employees that truly make a positive impact, not just an impact, but positive impact. And our commitment to workforce ensures a strong talent pipeline. It improves our patient care, and it thrives in our community. So here today in this rural area, we have a Piggly Wiggly and a Walmart. So we have enrolled and successfully trained 60 apprentices with a 100% completion rate. We have 10 registered occupations, and the plan to expand now in medical to MAA, to explore the MAA occupation, because we have several patient account reps. And so we're looking at a way to potentially allow them the opportunity to take the MAA or explore the MAA occupation, which back in the day, it used to be called medical secretary. We also have a dental clinic that has not yet opened here, about 20 minutes from our main clinic. And so we are looking to explore the dental assistant and dental hygienist occupation as well. And what I don't have listed here is we're also getting ready to launch pre-apprenticeships. So a lot going on in our small area. Next slide, please. What we all like, return on investment. So our workforce development here believes in investing in people. It goes beyond hiring. We came in, we didn't go out looking for our workforce. We build our workforce within our organization. What I may or may not have here is we have a very high retention rate and a very low turnover rate. We have structured program. We have wonderful seamless partnerships with different schools, and you'll see that as I go on. We offer top level clinical experience and different career pathway opportunities. So when I say something about different career opportunities or on-the-job training, we currently have a pathway of CNA. So we have 10 occupations and want their CNA, I'm gonna try to name them all: medical assistant, patient account representative. We also have non-healthcare related. We have IT, we have health information systems, we have registered nurse, which is RN, LPN. medical laboratory technician. So in all of those occupations, they receive classroom instruction, on-the-job training, and it helps to enhance their skills as well as their structured as well as a structured program. We provide educational time for our staff and tuition reimbursement. So let me give you a little bit example of how that works. So for our medical assisting program, and it's in these slides, but I may derive a little bit. So what we do is we allow them, our medical assistant program started in 2021. We saw a need that we still hire CNAs, but we all know from the healthcare world that MAs can do quite a lot more. We have a really good partnership with NEMA. We just had a graduate to graduate this week from NEMA, but we also have a partnership with local community college because some individuals or some staff do better by in person. And so what we allow our staff to do is if they take a course, they are allowed to get educational time. So particularly for the MA course, they meet on Fridays. We actually allow that to be educational time. So staff does not lose wages or pay during that time, and they're able to be coded as educational time during those hours. Their first part of the MA class at that community college or one of the community colleges is about 3 months. So every Friday, they're coded for educational time. We sponsor the course. They are registered as an apprentice or they apply with the apprenticeship application. And then once the course is over, any books or any resources, whether it was a laptop or any materials that they pay for during that course, they will submit an educational reimbursement form along with the receipt, their grade of a B or higher, and then we will also reimburse them for any books and any other resources they may have purchased. We like them to have some skin in the game, but we also will reimburse them. We did receive the 2025 Outstanding Apprenticeship Program Award this year. So that was very exciting that we were able to be the recipient of that award. It shows that all of the work we've put in, it really does pay off. Next slide, please. So I just talked about return on investment. It reduces turnover. Our staff stays longer. We have cost saving with internal training, lower our hiring costs. Okay, next. And then we have a sustainable talent pipeline for workforce needs. It improves our patient care, and we have a commitment to continuous learning to ensure growth and stability. Next slide, please, Megan. So these are some of our partnerships, and as I mentioned, we established a MA program here in 2021 with a local community college. They could not find an instructor, so we allowed one of our nurse managers to actually teach that course. And so they're able to be there with one of their peers on site to receive instruction. Also, when that course first started, it was only our staff. Now it has grown. We have 7 cohorts. We've had 7 cohorts since 2021. And so now there are actually other students able to join as well. Those outside students that register for that course, thank you, Megan. The outside students that register for that course are actually able to come here and do their clinical hours as well. Next slide, please. Several of those MA students that have went through that cohort are now going into LPN. So we now also have an LPN partnership with Halifax. They hold 3 to 5 spaces or slots for us to ensure that our students or our staff are able to take a training program. Next slide, please. Next slide. Next slide. Next slide. So we do to help to celebrate successes. We have MA ceremonies. We also are going to do our very first LPN luncheon just as a way to tell staff that we are invested in them and that we care. We invite their families, we give them refreshments, and we actually have a full-fledged graduation. Next slide, please. Next slide. Next slide. And these are just some of our success stories. I know that these slides will be available. Just want to tell you a little bit about Steve. He was actually our first apprentice. He actually started as an unpaid intern. He then went into IT as a specialist or an apprenticeship IT specialist for apprenticeship. He's now a full-time employee here, and he just graduated with his 2-year and headed to ECU for a 4-year degree. Next slide. And these are just some of our individuals, and you can just go through them really quickly, Megan. Next slide. We have a mobile unit. I forgot to mention that. But next slide, please. The only thing I'll close with is that we really value apprenticeships. Our programs here are so phenomenal. We have a great set of staff. I've really seen the transformation in individuals starting out and where they've come and how far they've come. Thank you so much for your time.
Thank you, Jaquetta. And there's so many great success stories in these slides, and as well as a YouTube video. So again, the slide deck and Jaquetta's recording will be made available to you within about a week or so. You'll be able to read through all those success stories and watch that video as well. From here, I'm going to pass it off to El Rio Community Health Center in Arizona.
Hey, great. Chiquetta, when you said it, I immediately thought of Piggly Wigglies. I hadn't thought of Piggly Wiggly in a very long time.
Yes.
But anyway, hi everyone. I'm Doug Spegman, Chief Clinical Officer at El Rio in Tucson. Next slide, please. So El Rio joined the Community Health Center movement in 1970, and we've grown into a very large system serving more than 130,000 patients. Next slide. As is common in community health center world, vast majority of our patients are at 100% or below of federal poverty. And the characteristics are also similar to most health centers, with the majority being under Medicaid. Next slide. So really what we're talking about is how do we, as the providers of community health and community medicine, how do we step into the gap of really taking ownership of workforce development, clinically and otherwise, to meet the needs of the community health center movement. You'll see in these slides, this slide, that we are an equal opportunity collaborator, so that we glom on to many different programs with many different affiliations. Today, we'll talk about a program that we developed with the Weitzman Institute and Community Health Center, Inc. of Connecticut, which they led the way of encouraging us to create advanced practice nurse practitioner residencies. Next slide. We also, though, recognize that you have to start early. And so in the state of Arizona, our AHEC is divided into 6 sections, 6 geographical regions, and we decided to enter that space. So El Rio oversees the Southern Arizona AHEC. And we think that's important, not only as you develop programs like the APRN residency, but as you try to influence and guide people to understand the needs of community-based medical programs. Next slide. And so really our clinician and clinical workforce, we are guided by these principles that we need to train clinicians how to succeed in our environments. And who better than us to do that? And that it's a team-based interprofessional experience, that a lot of it is also how do we make workflow efficiencies better? How do we harvest our electronic health record to really create clinical decision support for the clinicians that work in our environment? And that we want to really take ownership of the experience of the work. We have people that by and large understand the mission. And it's not for lack of mission that people get discouraged or burned out. It's because the intensity of the work. So we are fully committed not only of training people how to succeed best, but iteratively how to improve so that we support our workforce. And so with that, I'll just toggle over to our director of our APRN residency, Jessica Smith. Next slide, please.
All right, wonderful. Thank you, Doug. And I also wanted to wish everyone a happy Nurses Week. I know we have probably many nurses out there, so happy Nurses Week. Really, you know, I started out as a nurse. I am a family nurse practitioner and focused in primarily in family practice. And so I originally had graduated from this program in 2019. So it's kind of bittersweet to come full circle and really taking this program under my wings as well. Something that helped me build my foundation and get started. And so we did start the program in 2019. And so first class graduated in 2020, really based on the model of the Consortium for Advanced Practice Providers. And so we are accredited with this, with the consortium. And so they have very different standards that we follow. In addition to that, we also are a recipient of the HRSA A&E NPRF grant as well. So I think that having the standards and also, you know, kind of helping to reach our goals within the grant as well has really helped shape this program. And so I'll talk a little bit about our program and what that entails. So it is a 12-month full-time position, and we treat our residents as they are providers that are signing on to this organization. So they get all the benefits as a provider would with, you know, CME, PTO, retirement, those kinds of things are built into their package, their benefits package. In addition to that, we do give them continuity clinic. And so they will get 2 continuity clinics usually per week. And 1 continuity clinic in pediatrics. So we have a really high pediatric focus as well. And then the rest of the time is filled with mentor clinics and also specialty clinics. We have about 12, and we keep adding to our specialty rotations. And that can be anywhere from dermatology to pulmonology. We have pediatric psychiatry that they all rotate throughout the year. And then we also have 4 hours, 4 hours a week dedicated to didactics. And so that's where they're getting all their learning. They're either getting live lectures from speakers within the organization or within our community that do speak to them about different topics. And then they get, again, you know, admin time. So they're treated just like any other provider. So they get some admin time to answer in-basket questions and then anything they need to do during that time. But we do have a really high focus on our pediatric care and training. You know, our goals are to really close those health disparity gaps. And right now we are, you know, trying to recruit right now for our fall cohort. And the goal is to have 8. And so that's typically where we have been. So with the exception of this last class, we have 4. And we're going into a little bit of a different model. You know, we have some working collaborations with the University of Arizona to really help solidify this pathway for our students. And so we select 2 students a year from the University of Arizona, and they work through our organization. And the goal is to really get them exposed to the federally qualified health center and the patient population that is here. And get them that experience. And so that way, with the goal also being that they will apply to our residency. And so we have that pathway as well. And we can go to the next slide. We are in our 5th class, and this class started in September of 2024, not 2025. We do have 30 residents that have completed our program. 4 residents are in our current class. Our current attrition rate is 15.4%. But we do have a 93% retention rate for those that complete residency. So really our goal is to also get them employed at El Rio at different health clinics. And we also have 3 rural health partners and within Southern Arizona. So and we also try to get our residents into those areas too, if it's an area that they are really wanting. And so we do have rural health partners as well. And we can go to the next slide. And so this is some of the cost considerations that we have. And so this is our 2025 budget, and this is based on our 8 residents and kind of the breakdown of what that looks like. So with our residents, we have gotten about 7,665 patient visits, and the average number or monetary value per encounter is $306. And so a way that we supplement as well, and with this is we use our HRSA A&E MPRF grant, which will expire in 2027. And so if you have any questions about our budget, please let me know. I don't think I put my information in the slides, so I'll make sure to share that within the chat. And I think we can go to the next
With
slide.
helping organizations, the financials is always the most difficult, so happy to support as well.
Yeah. Okay, great. Thank you. And this is our average productivity. So this is from our 2023 class that graduated in 2023, and they had 1 full year of employment under their belt at this time. And so we have 4 residents that stayed at El Rio. 1 did go to our partner site down at Chiricahua in Sierra Vista. So she's not included in this number, but the 4 that did stay here at El Rio kind of just shows you where they're at as far as like their productivity with their first year. Next slide. So retention and sustainability. So really our goal is to, of course, adequately train our residents in community health medicine. Our return of investment is positive. And, we also want our residents to work at the top of their scope. So I think that really helps to also get them prepared for practice as well. And so with our new student to residency pipeline, that also is helping with recruitment efforts to really fill these residency spots that we have. All right. All right, and I think that's all I have. Unless anyone had any specific questions, let me know. I'm happy to answer.
And
Oh, and I
I
think
was
you're
on
muted.
mute. I was on mute. Awesome. Well, we're going to dive into our Q&A now. We have lots of wonderful questions that were put in the chat and Q&A. So just a reminder to submit those as well. Our first question I'm going to ask is from Crystal, and it's, did you use grant funding to build your program? And if so, what are the grants? And I welcome everyone to answer this question. Jaquetta, if you want to go first, you're off mute, so go ahead.
Sure. So I'm not too sure of what grants we use. We do have a grant administrator or coordinator here that I can connect you with. I do know we received a lot of ABA funding from Apprenticeship NC from us having these apprentices. So we have about 5 apprentices that's receiving funding from the state. But I can get Mandy's information to whomever wants to drop the information in the chat or their contact and connect you to Mandy, and she will be glad to share with you.
Fantastic. Anna, do you want to go ahead?
For us at the Comprehensive, I think it was more of the support by our board of directors and our executive leadership. We did have a struggle at the very beginning as far as personnel, finding somebody to run the program and to actually be the leadership for it. So that was the first challenge. But other than that, the Comprehensive has really stepped up to financial commitment by providing tuition reimbursements for our employees for career advancements, and even to the point of allowing us into the clinics, which is really the key, right? But yeah.
Absolutely. And Doug and Jessica, do you want to speak about starting the program without grant funding and then getting the HRSA grant?
Yeah, I'll take it, but then Jessica can take it from there. Look, this is all about commitment, and I get it that financial times are never perfect. They weren't perfect back then. They're certainly not perfect now. But specific to an APRN residency, that is probably one of the more cost-effective residencies when you're talking about clinician residencies. And so key to all of that is what's your vision, and do you have leadership, not just clinical leadership, but financial and CEO leadership that understands the vision. And then the board of directors from community health centers, they are our patients. And so having them understand that narrative is very helpful. And then I'll hand it off to Jessica, because we are blessed that we had the HRSA dollars that then followed the vision. So go ahead.
So currently, like I said, we do have the HRSA A&E and PRF grant now, so that's really helping to fund 6 of our positions right now, and it also allows us to do any other activities. So we use that for some wellness activities, and also to pay for other things that we might need for our residents. I forgot to mention that we do have ASU, which is Arizona State University, as our academic partner. And so we have so it's nice to have that little extra grant money to kind of go to help us with these different partnerships that we have, and really just investing in our in our residents. So it's really enabled us to do different things.
Fantastic. And Heather, could you share more about your grant funding opportunity?
Absolutely. So as I mentioned, we started with the Department of Labor grant for nursing expansion, but also our partners have different grants that they are sort of sandwiching with ours. So we are working with Missoula College, who has an AHEC grant for a LPN to RN bridge program. And then there are Perkins grants out there that are also working with some of our students, in addition to WIOA funds. And we work with our care coordinators to work with our apprentices and find every little pocket of money that we can in order to support the ongoing education of our apprentices.
Absolutely. Awesome. And then our next question, I think this was specific for Jaquetta, but everyone can definitely answer it. It's how do you approach surrounding schools to start the process of creating an apprenticeship with them? But I'll open up for everyone because all of you require academic partners and community partners. So if anyone wants to share the value of those academic and community partners, that would be wonderful.
I'll fill the void. So all I'll say, and we were having meetings earlier today about this topic, it is very important from an FQHC world to understand that you're an equal partner at the table. And frequently academic partners, and no casting aspersions, but they have their own agenda. And so the point of it is that it is great when you can forge those collaborations as equal partners. We bring to them the patient population, the experience in community-based health that's very different than embedded clinics in academic centers. So very important, but I guess one note here is enter that space, understanding and being empowered to be an equal partner in that space.
Wonderful. And Jaquetta, do you have any notes to share?
I will. I'll say be intentional. I come from a community college resigned from the community college about a year ago to come back as a dean to come back to the health center and work. I worked here in the past, but came back as in coordination of apprenticeships and internships. But I can tell you have to be intentional with the community colleges. And one of the things that, because we don't typically have one university here and it's a private college, but being intentional with them is talking their talk, saying, hey, this could increase FTE for you. This could be a way to develop more partnerships. Like I said before, they knew they needed an MA course, but they did not have any willing nurse to teach it. And so we went back to the table and say, listen, we have enough nurse managers. This young lady is willing to take the training. So we give her educational time on Fridays so that she's able to be contracted by the college to teach this course for our staff. And so that's one of the things I say, be intentional. And then being intentional with that community college opened doors for us to be partners with other community colleges as well. When we identify need, we go to the table and start with who we think needs to be there. And then if they need to bring in more leadership, then we reevaluate it and we meet as much as we need to till we derive a plan that will benefit all of us.
Absolutely. Awesome. And Anna, did you have anything to add?
Oops. Yeah, I was just gonna concur with my colleagues. You definitely need to be intentional as to what you're doing, but I think for us here in Hawaii is a little different in the sense that we have multiple islands that create a distance issue for us. So transportation is definitely a challenge, but reaching out to those that are in, a severely separated area, I think is crucial. I think for us in Oahu, we have a lot of resources and we have a lot of programs that are available here, but on the other islands, it's a lot more restrictive. So I think taking a look at that is also a great partnership, understanding that like community colleges is really that economic availability to education. I think also that understanding that these partnerships in these isolated areas are crucial because many of the residents that are there are really, in a way suffering as to having opportunities to advance and to move forward or even to create a career. I think that's important for us as CHCs and FQHCs to understand that the growth is really more than just healthcare. I think healthcare is the vehicle that we use in order to advance our people, our community, our economic status. I mean, it's just encompassing a whole lot, right? As far as life. Yeah.
Absolutely. And Heather, do you have anything to add to academic and community partners?
I really don't. I think you've all said it so well. I mean, we built ours on the partnership. I am a former nursing educator. From one of the community colleges, I came over to do this project, and I am actually on my way back to the community college. So we see a lot of the cross-pollination amongst our small Montana University system. And so, yes, I co-sign everything said here, for sure.
Great. And in our final moments, I have one final question to ask of either how do you show your return on investment is more than financial to your leaders, and how do you get that leadership and board of director support? Any final words of wisdom?
I guess I'll start off. For us, I think it's the retention of many of our students. They start off as students within the program. Many have now moved up in their career, starting from a medical assistant. Now we have some that are clinic managers. We have another individual that is a senior clinic manager. So I think seeing that progression of growth and that career advancement is that publication that you cannot get anywhere else, that it is something that is doable, and that if she can do it, I can do it. So I think it's definitely a motivating factor for others to venture into, education and career advancements.
Absolutely.
And
go ahead, Doug. Go ahead.
Sorry about that. I was just going to say that if you haven't gone down the path, it kind of is it seems to boards and maybe other senior leadership a leap of faith. But that's when I would invite anyone on this call to reach out to any of us or others, because we have data that shows not only the impact on retention of the individuals that go through the training, but also the impact in general, and I'll use our case, of entering the space of a teaching health center and what that does to everyone else. And I would be happy to share our turnover rates, our retention rates, our recruitment rates. There are enough of us that have been in this space that I think that can tell a very powerful story for those just thinking about entering this space.
Fantastic. And I'm going to shamelessly plug that Doug's organization, El Rio Health, participated in the Weizmann Institute's and Community Health Center Inc.'s free learning collaborative on postgraduate nurse practitioner residency programs. So if anyone wants to learn more, please reach out to myself. I'm happy to connect you with that opportunity and other resources. And fresh off the presses as of today is a new research article on it. So please go check that out and you can learn more. Awesome. And then Heather and Jaquetta, did you have any final thoughts before we jump to our next session? Awesome. Perfect. I see you're all silent, but thank you to our audience for your wonderful engagement with our panelists. Thank you to our panelists for giving those quick presentations with so much knowledge, just a jam-packed 60 minutes. And I know most of your contact information is in the chat, so thank you for providing that to our attendees, and have a great rest of your day.
You too, Megan.
With
Thank you all
that,
so
we're going to
much.
take a moment to transition to our next session, which is focused on strengthening emergency preparedness for community within health centers. Awesome. Great. So like I said, we're going to transition to our next session on strengthening emergency preparedness for the community within health centers. This presentation is going to focus on emergency preparedness for not only your health center, but as well as your patients, your community, and your staff members as well. We have two fantastic presenters with us today. We have Matthew Griswold from Community Health Center, Inc., and Taina Lopez from the National Association of Community Health Centers. I'm going to ask if Matthew and Taina can each come off mute and go on video just to introduce yourselves, and then we can also make sure that your audio and video is working.
Hi, good afternoon, everyone. This is Taina Lopez, Director of Emergency Management from NAC.
I am having video trouble at this point in time, but there we go. Start my video. Thank you, Megan. I'm Matt Griswold. I'm the Director of Facilities with Community Health Center in the Moses Weitzman Health System.
Fantastic. And with that, we're going to dive into our presentation. So I'm going to kick it off to you, Matt.
Thank you. And thank you everyone for having me today. I get to share a little bit about our experience at CHC, but as well as my near 20 years experience in emergency management throughout healthcare. And what we're going to talk about today is really a focus on the staffing side and recovery side of emergency preparedness, and we'll get into the granular details of that in just a moment. But I wanted to just cover what emergency preparedness is. And I don't need to read it verbatim, but I will, just in case anyone is not familiar with what emergency preparedness or emergency management is. But preparedness is defined as a continuous cycle of planning, organizing, training, equipping, exercising, evaluating, and taking corrective action in an effort to ensure effective coordination during incident response. And again, we're going to be focusing on the recovery side today. I don't think I can progress the slides, but let's progress one slide. So the principles of emergency management shown here, mitigation, preparedness, response, and recovery. Again, my portion is going to focus solely on the recovery side, but truly when you're talking about thinking about staff and managing for staff in any event, it really starts with every single one of these phases. We can progress another slide. What I wanted to show here is just while planning for staffing is having specific considerations, what we're talking about here is your typical longer event. We're not talking about something that is over and done with in 30 to 45 minutes. Ideally, those are the emergencies that happen, and we are so effective, or our partners are so effective at restoring back to normal. But truly longer duration beyond a normal work shift, you have to start making those considerations for those individuals, and they're going to be on your mind. Right? You've been there, you've done that, and I'm sure you've seen where it starts to be what's happening with childcare, what's happening with my pets or my other loved ones. These things can go several days, weeks, and now we even know months and even years, depending on what it is. So these things have to be part of your plan, and that's what we want to talk about today. We need to have things factored in for food, even if it's a work shift. You need to take care of those people that are taking care of you, your families, again, your pets. Are you displaced? Do you need places to stay? And we'll talk a bit more about memorandums of understanding, but those partnerships are going to be so key in your plan. Your plan can never be done in isolation. We can progress another slide, please. What I wanted to show here is the relationship between the phases. I did provide just a quick table of contents from our plan, and even inside of the appendices is where we really call out some of these memorandums of understanding, making sure that they are documented and they need to be worked and exercised as much as any other portion of your plan. So when you are creating, leave space so that you can plan for your staff. What are you doing? We'll get into the committee component in a few moments, but that's really where we need to make sure that everybody is on the same page and how you're managing for that. So if we can just do a couple clicks here and we'll just talk about the relationships. So right from a preparedness perspective, it starts with preparedness. You need to be prepared for the worst for those individuals. I know it's all about getting back to normal, but normalcy will not happen if you're not taking care of those folks. And we'll keep clicking through. And through the recovery components of getting that position back to normal. And of course, the mitigation is is kind of the beginning point of this process, and making sure that you have your plans in place as we discussed. We can progress. We've just defined here some of the emergencies that some of us may experience. Not one location geographically is the same. I've heard from one of the last panelists, they were in Hawaii. I can't imagine what they might go through. I would like to think that we're fairly lucky here in the Northeast, but we have our series of extremes as well. Hurricanes impact us, earthquakes happen. We've had droughts where wildfires are spreading. We had one last year. Of course, pandemics, and the list goes on and on. This is just a small sampling of what can happen. But in every single one of these situations, you have to factor in what's happening with staff, especially when they become a longer duration. And here I really just wanted to focus in. This is we've used this parts of this presentation before, but I really wanted to focus in on the community side of things and really dive into those memorandums of understanding. You may have alternate care sites, and if we can just do one click, because it will provide the emphasis here. It's not overly vital, but here we go. We put it in, might as well use it. The idea here is, do you have convention centers? Are there educational facilities that are supporting you? If you have a long-term event and you're displaced, your kids still may need to have education. These places may have some abilities to provide that. They may have the food resources. They may have some of these other resources that you need. What are you doing about power? What if your generators fail? Do they have systems in place that are going to help you? And of course, health centers themselves always have an ability to help these other folks. It's not about what you can always get. It's also what you can give. It's a partnership, but look into those and make sure that those are well called out and spelled out in your planning efforts. And again, underneath the emergency preparedness plan, focusing in on recovery, and if we can just, again, just throw the emphasis on there with the next click. It comes down to your communication as a system, okay, and communicating to those staff that we have a plan for you, that we are here to support you, and making sure that it's drilled and they understand what's taking place. So if you're doing a drill, make sure the injects are in there, that this thing has gone multiple days in your operational periods are X, and that we need to really stress this with those individuals that are participating. hopefully it doesn't turn into a real event, but making sure that you stress your systems, right? Work on those relationships, take part. I know in our region, we work with our healthcare coalitions, we work with other key partners during their drill practices to make sure that we're stressing our systems at the same exact time that they're stressing theirs, so we understand exactly how we can better support one another. And always commit to regular reviews and updates of all of your plans. And again, getting into those MOUs, because they may have, in many cases, they're going to have deadlines. They're going to terminate at some point in time, but you're going to find new players that are always coming to the table who want to support. If we can progress, there we go. So in the committee process, we really wanted to call out very specific things here as well about being proactive. And being proactive when it comes to staffing is right at the planning levels of making sure that you have these in your plan. We've talked about that. Just want to make sure that really sinks in. And if we can just continue to progress through. On your committee, and I think we have another slide right after this as well, it's just making sure that you have a variety of expertise and perspectives. This cannot be done in isolation. So even on your committee, it's great to have outside set of eyes in your review process. So bring those partnerships in, work with your fire department, work with police, maybe work with a hospital or an educational facility, and have them give your plan a review. That's certainly best practice. I think we had another slide there to progress to. And one thing that we just wanted to call out here is if you look in this second block here, including participants who are passionate or experienced. Experience is definitely a key function of anyone that plays a role inside of your command center or on your committee. But I love the passionate comment here, making sure that you have people who really want to be involved. And not just having the experience, but really want to make a change, know that they can help. Maybe they have other key relationships out there in your community. It will pay dividends later in your entire planning process. And then when an actual event arises, you're going to watch how easily you navigate through that emergency because of individuals like that. And for my last slide before Taina kicks things off, so we just have a couple resources here, one of which is, I think, a further breakout of this webinar. But what I'm really focusing in on here is that there are some courses. If you haven't taken any of the free courses from FEMA, I would recommend it. It really gives you a great building block for your education in emergency management, right from really the federal government and the people who really drive a lot of these programs. Without a doubt, it's something that's blossomed in my career and really helped me in my time. And then go beyond that. There's going to be community events where these are constantly taking place. Get involved, and you're going to watch how your career can really take off with emergency management, your understanding of it. So thank you for the time today, and I'll pass it over to Taina. Thank you.
Thank you so much, Matt. I appreciate it. I appreciate that review. First of all, I'm going to apologize because I am on the decline. I feel like I'm getting sick, so just bear with me as I try to get through this. So again, Taina Lopez, Director of Emergency Management from the National Association of Community Health Centers. I wanted to speak to you about really lessons learned from real world emergencies in supporting staff. And we'll go to the next slide. So NAC has been involved in multiple emergencies, but these really sort of highlight some of the staff needs during a major sort of catastrophic event. I think they're really good opportunities to learn from these events. So first, I'm going to share perspectives from Hurricane Helene and Milton and the LA wildfires. Just for some context, how NAC was involved in these, right? We are not on the ground supporting frontline operations. We're helping to support coordination when an event comes. So if you do suffer sort of any emergency or any catastrophic event that you need support, NAC can be there to assist. Number one, we're able to support with coordination with the health centers and the primary care associations to connect health centers who are experiencing resource needs to the NGO partners that we work with, right? Whether that's funding or medical equipment, vaccines, any kind of support, and then sharing information. It becomes really important in sort of these really large scale emergencies to be aligned and understand what's working in one region may also support another region. So NAC has been involved in sort of supporting these disasters in that respect. And, you know, I think one of the things that we've learned from these disasters that health centers are as strong as their staff are, right? If we are not accounting for what could happen to staff, then we don't know if health centers can open their doors and they can serve the community. So next slide. So this is lifted directly verbatim from our draft after action report. So this will come out in the next couple of weeks, but we did an after action process meeting with some of the primary care associations in the southeast of the United States who responded and helped health centers respond to Hurricane Helene and Milton last year. And two of the major lessons learned, one is on disaster assistance and two is on well-being. So one for disaster assistance, there was a lack of familiarity with the FEMA disaster assistance process and how staff can navigate and access that, right? So as part of our after action, there's a recommendation, you know, I would say overall to do more training on what that could look like and what the FEMA, it's called individual assistance, looks like and how staff could access that. But what I would say is two, most importantly, that second bullet under recommendation is how health centers can work within their local jurisdiction, to Matt's point about working locally, working with your local emergency management or healthcare coalition to connect you to someone who can navigate health center staff through the FEMA assistance process. And I'll just take that with a grain of salt because we know the federal landscape is changing in emergency management. FEMA and FEMA assistance is in the news every day. But you know, however, that's a finding from these hurricanes. Two, staff well-being. More could have been done, not only to document, but really to address the needs of staff during an emergency. There were substantial impacts to the staff, really that significantly impacted the recovery time of the health center. And I just want to point to, I think, at least one place that Matt mentioned was childcare. I have seen that consistently come up, right? So in your planning process, when you're sitting down with these committees, talk about what a catastrophic event looks like. And schools are closed and staff cannot send their kids to school, right? So how can you mitigate that? To Matt's point, there are community-based organizations that you might be able to build relationships with. I've seen health centers stand up sort of child day camps where they're watching the children so staff can go, you know, to work basically. And mental health, right? That was just a big gap and recommendation needed. So I'm going to point to this staff support plan. So when you're building your emergency plan, think about how you can build in staff support in an emergency. And we'll talk about that, I think, in the next slide. Yes. So if you can go to the LA County wildfires. So here's some lessons learned from health centers that went through the wildfires. What I would say is this: these are sort of like planning considerations. As you're building your plan, these are areas to think about. Developing this staff-centered emergency plan, this support plan. What are you gonna, you know, how would you evacuate staff? How could staff communicate if the phone lines are down? Is everyone on WhatsApp? Can you send out sort of these messages? I know that's how they've been able to communicate in other disasters. How are staff assigned for roles if the decision maker is unavailable, right? Identifying the sort of those backups in leadership. Two, being able to maintain accurate staff contact and location data. That was really critical. Again, in LA, is that health centers had that information and they knew if staff was going to be evacuated or this region was affected. So being able to, you know, have a sense of where staff was located. Three, important, I think to Matt's point before about training your staff in emergency roles and cross-training staff. So if people are out who do this normal function, other people are able to step into that role, right? And including sort of behavioral health, mental health, disaster mental health, and trauma-informed care, and establishing internal communication channels. Again, we talked about sort of how can, like, maybe using WhatsApp, or is there another way to communicate if phone lines are down, if there's a cyber incident and you don't have access to your systems, right? There are some emergency management organizations that offer two-way radios, right? There's a two-way radio program I know from some emergency management systems, and they'll offer that to the healthcare systems nearby. In response, some of the considerations that you should think about when in this phase is prioritizing staff safety and well-being. The first thing that I've seen in many of these major emergencies is accounting for staff. Are they safe? Unfortunately, like, are they alive? Do they have their homes? So is there, talk about that when you're in your planning process and think through how you might do that. Because I've seen catastrophic disasters where this is vital. Offer flexibility for those dealing with whether it's personal loss, they've lost their home. In the LA County wildfires, there was one health center that had 20 staff who lost their home, and I think it was like over 50% of their staff were displaced. So think about the impact that that's going to have on your ability to keep your doors open and serve your patients. So can you support them with basic needs? Are there organizations nearby that provide food, housing, transportation? Speak to them before the disaster happens, whether that looks like a memorandum of understanding that Matt pointed out, that MOU, or whether that looks like relationship building. Those are important to really think about these. They're often overlooked, right? There's a focus on keeping the doors open, but the doors won't stay open if your staff is not there. So again, maintaining communication, the coordination of internal volunteers. Are your staff deploying to a nearby shelter, a nearby organization where they're seeing patients? So how will you coordinate that, especially if there's a lack of communication? And next slide. In the recovery phase, mental health is going to be critically important. People have been through a traumatic experience and they continue to go through a traumatic experience. So provide access to counseling, peer support, train in the recognition of trauma, compassion fatigue, really supporting the long-term recovery of your staff. I've seen health centers make staffing hours flexible, or people plan to stay at other people's houses, right? So and then when the time is right, it's great to recognize and celebrate staff contributions, and lastly, document and debrief, because emergency management, Matt said it, it's a continuous learning process. So you want to learn from what has worked, what hasn't worked, and how you can do better in the future. Next slide. So lastly, I want to leave you, excuse me. I want to leave you with a couple of resources. I love, I'm emergency management. I love Asper Tracy. It's a great sort of library for all things healthcare emergency management. They have a topic collection on responder safety and health. So you can go there to look for tools. I pulled out this one, tips for retaining and caring for its staff after disaster. It talks about a lot of the things that I went through in this presentation in a bit more detail and how you can incorporate them into your plan. We are launching a tool. It's actually with HRSA right now being reviewed about FEMA individual assistance and some of the federal disaster assistance. So hopefully that can help staff and health centers navigate that disaster assistance process. And lastly, these are some of our NGO partners who have been incredibly helpful. They're just great partners of health centers. They've been incredibly helpful in times of disasters. If you don't have these individuals in your emergency plan, put them in your plan. Because when a disaster comes knocking on your door, these are some of the NGOs that you're going to perhaps want to be able to, access medications, access flash grants, $25,000 flash grants, access critical medical supplies, basic hygiene. And so they're just great partners. I just give a plug for Direct Relief. You can go there and enroll with Direct Relief. And, if a disaster happens in your area, Direct Relief will do the initial sort of outreach to you. And then lastly, I would say NAC can always be the conduit to these NGO partners. You don't have to reach out to them alone and navigate this alone. I'm more than happy to put you in touch with them during a disaster and connect you to the right resources. But I think they're just good to have in your back pocket. And I think that's it for me.
It is. Thank you both. A reminder to put any questions or comments for our presenters in the chat or the Q&A function. I want to thank you both for providing that amazing presentation, just really reminding us that our staff is also a part of our community and they are also a part of the emergency that occurred, and we also need to care for them when emergency strikes. I just want to ask, how do you establish local and national partnerships, and what are some lessons learned or key takeaways for establishing those partnerships in advance of the emergency occurring?
You want to start, Taina, or?
I'll start, right? Every county, city, state looks different. So I can't tell you in the county that you're in that you may or may not have a healthcare coalition. If you have a healthcare coalition, those are funded by HHS, ASPR. They're still running right now. They are very connected to emergency management. They are looking to engage with health centers. So that's a place to start, and they can connect you to emergency management. If you don't have a healthcare coalition, go directly to emergency management. Call them up on the phone, knock on their door, tell them what your health center offers. Invite them to your health center to come look and see what assets and resources and how you can. They have resources in a disaster, you have resources. How can you better align? So that's just one recommendation. I'll leave it to Matt on any other thoughts.
Yeah, I think there's a ton of resources out there, and if people aren't aware of them, some really fantastic starting points. One, your Department of Public Health. Your state has an emergency management agency as well, and there's different variations of that depending on the areas in which you live in. If you're regionalized, you're going to have specific resources there as well. Again, healthcare coalitions. And if you really need a really simple starting point, you can truly go and knock on the door of your local police or fire departments and start having those conversations with those partners. I've seen that as a starting point for a lot of organizations, and it really has turned into great relationships, and they appreciate the fact that you want to partner with them.
Fantastic. And another question. Oh, go ahead, Taina. Go ahead.
I'm sorry, just we are actually working on a small toolkit to support this on how health centers can connect to local organizations, a script to share with your emergency management or healthcare coalition, facts about what health centers do. So just be on the lookout for that from NAC in the next couple of months.
I'm on mute. Fantastic. Thank you for sharing that. And then we have another question as well. What can individuals do to help prepare themselves, their families, their organizations, and their communities for emergencies?
It's like to lean on ladies first if Taina wants to go. I know she's feeling under the weather.
Go ahead, Matt. I'll let you go. Thanks.
Okay. Let me focus on a piece of that. For yourselves, for even personally, you should have your own kind of emergency response plan for your home, whether it's fire related or other, right? It could be a winter storm, something along those lines, but have a plan. What are you and your family members going to do in the worst case scenario? selfishly you want to do that to take care of yourself because you can't help out your organization until you know that you're taken care of, and vice versa. They'll take care of you in turn. I think, what was part two of that question, Megan? I just want to see if I can try to
We
put
have
that
themselves, their families, their organizations, and their communities.
Yeah, I mean, the community piece is really just about getting involved. So it's whether it's through your organization and you're getting involved in that way, if it's your personal community. So I live in a very specific county here in Connecticut, away from our CHC. The idea here is to get involved as well, share your experience, make some friends, and let people know that you're there to support as well. Understand what businesses and what resources are around you, especially if you have the experience coming from a healthcare sector.
Megan, I'm not sure if I'm able to put something in the chat, but ready.gov.
You can.
Yep. I can't figure it out. I'll try to do that. Ready.gov is FEMA's resources, right, on individual preparedness. So that's a good place to start. American Red Cross has those, sort of individual family plans. Even Sesame, I use those with my son. Is all about, he's like, let's pack the emergency bag, Mom, let's do a drill. And because they have sort of age appropriate ways to talk about that with little kids. Thank you.
Great. Yeah. And in the chat as well, I want to shout out Denise, who wrote in 2 great resources, Alert Media and Direct Relief. So feel free to check out those organizations as well. And then our final question for the summit and for this panel, just want to ask, so our theme was building a workforce for 2025 and beyond. How do you prepare your workforce for preparing for emergencies? Do you share information in town halls, SharePoint? How do you get the word out?
I guess I can take that one too. I mean, the truth of the matter is, whatever your communication vessels are, use every single one of them. We use SharePoint, and we also use Snapcom as a communication tool, and we can put out anywhere from banners to flyers, screen takeovers, whether an event is actually happened or prior to. But there's other systems out there. You definitely have communication tools at your disposal. And every one of them is a great method to deliver that message, and certainly the reminder of telling people to be prepared, reminding them to be prepared, get that bag ready, get that case ready, whatever it is, and put it inside of the car. And all fantastic communication tools for your staff and beyond.
Megan, I think I would just add, I saw Alert Media in there. There are built platforms for emergency notifications that you can put your staff on. We use one of them. There are others. I mean, really, if you want to get that sophisticated, I've seen people do it on WhatsApp, right? So it's the level that works for you, but you need to have a plan, and you need to have a backup to that plan. I think is the key.
Absolutely. Well, thank you both again for joining us, for sharing those resources, and for sharing all your expertise and lived experience. So thank you again for joining us. And with that, we're going to dive into our closing remarks. Great. Just give me one moment to go ahead and pull up that content. Great. And Michelle, I see you're on camera and can come off mute. Do you mind just kicking off our closing remarks, and then we can dive into those Mentimeter word clouds?
Yes, absolutely.
Awesome.
So really, just to close off everything, I just wanted to give a very heartfelt thank you to everyone. So if everybody could give me a moment, I just kind of want to go through and thank everyone. So our wonderful colleagues at CHC Inc. and NAC and this wonderful planning committee, the amazing advisory group. Really, you all were with us throughout this whole process. So just thank you so much. Obviously, our HRSA partners, thank you for coming in and speaking to everyone. And then, of course, cannot forget each and every one of you who is here in the audience, as well as all of our speakers and our panelists. Truly just amazing, amazing information and content that you all presented. And for all of our attendees, all of you were absolutely wonderful, so engaging. The questions you asked, you were just, it was so lovely to have you here. And I hope all of you are able to take some of this content and go back to your health centers, be able to apply some of this, and really just work to strengthen and support your workforce. All three of our organizations, ACU, CHC Inc., and NAC, are obviously here to help you with anything you may need as NTAP organizations. So again, thank you everyone for being here. I know Gerard will also be joining me in some closing remarks in a moment. But yeah, and I do hope everyone also just has a wonderful rest of their week and weekend, since we're almost there. We're almost at the weekend. So Gerard, I'm going to go ahead and pass it over to you.
Thank you very much, Michelle. On behalf of NAC, I certainly want to echo what Michelle said. It has been a joy for us to have this opportunity to reconnect with our colleagues at CHC Inc. and ACU to bring this Health Center Workforce Summit to you. And the old adage, time flies when you're having fun. We spend at least 6 months planning these events, and then in 2 days it's over. I mean, it just seemed like it went by extremely fast. But we appreciate the partnership, and we're so always really look forward to this opportunity to connect with the workforce. Development specialists, folks at all levels of the health center who are engaged in this space of workforce development. This summit is for you, and we appreciate the engagement that you've had throughout participating in these polls and in your reactions throughout the session. We hope we've been able to accomplish the objectives that we set out at the beginning, and that you found this a good use of your time. Also, I want to recognize my colleagues from NAC, Katja Lepke, Pamela Ferguson, and Beth Kajowski. Certainly appreciate all the effort and the hard work that you all put into the planning and development of this with us as well. So they're behind the scenes, but they've certainly contributed greatly to the development of this summit. So it's been a joy, and I'll turn it back to Megan.
Actually, would you mind if I just added one last thing really quickly? I do want to give a special shout out to Megan specifically. I feel like Megan was really our fearless leader throughout this, just her organization, everything. And as Gerard said, we had a lot of people also working in the background at ACU, at CHC Inc., at NAC. But yeah, I just thought let's give Megan a special shout out because she really just her organization, everything. So thank you so much for leading the charge here.
Thank you, Michelle. You didn't have to do that. It was my pleasure. Everyone energized me, from your presentations to your questions to your comments. I just want to thank you all again for really engaging with our speakers who all took time out of their busy schedules to join us here. We're going to end on this really positive note of your one word that captures your biggest takeaway from the 2025 Workforce Summit. I already see some amazing responses of and I know this is so hard to comprise it into one word. So I love the folks that are adding in multiple words into one word. So we got hub of innovation, excellent expertise, transformation, inspiring, light, which is, yes, absolutely, growth, leadership, impactful. So with that, I think it's appropriate to end on these words of wisdom, of positivity, and of just thinking about the future moving forward in that positive light and of inspiration. I'll also just share my screen one last time with our contact information, how to find us, how to stay in touch. So again, the Workforce Summit was put on by the three organizations of Community Health Center, Inc., the ACU Star Center, and the National Association of Community Health Centers. all three of these organizations do receive HRSA funding to provide free training and technical assistance. So we all have archive resources that you can access. We have live content that you can access. So please visit our websites. Please send us an email. I know I've put my personal email in chat several times, and I've gotten several emails throughout the day. So again, do not hesitate to reach out. We can connect you to those resources, and you'll receive the content of this Workforce Summit within about a week or so. So thank you all again for joining us. Reach out if you need us, and have a great rest of your day.
Congrats.